Well, good morning. Good morning, everyone. Welcome to the 9th Annual Virtual Data Expo event. I feel like we were just here, so a year went by really quickly. Whether you're joining us from your living room, your office at work, your cell phone on the go, or your office at home, or one of our viewing stations around Sacramento.
That's right.
I'm John O'Hanian, and this is my co-host, Adam Dondro.
Thank you, John.
Welcome.
For those who don't know me, I'm the Director of the Office of Technology and Solutions Integration, formerly known as OSI, and your Agency Information Officer. I always love being a part of this event. It's been great for 9 years now, I believe. Always exciting. And this year's not going to be any different. One of the reasons that it's always great is we have such a diverse audience. Today we have, do we have a number? How many folks we have on so far? Over 400 folks so far, and the number's still counting, so email your folks, get them to join. We've got policymakers, department and agency leadership, data analysts across the spectrum, and what's really meaningful about that for me is that we don't have just all of you data experts, but the data users here with us, and that's the whole point of all of this, making the data usable.
So let's get to some housekeeping items and get this thing going. They're posted in your chat for your convenience, but if you're listening right now, if you can't hear the speakers, if you can't hear me talking right now, make sure your computer audio is on. If not, call tech support. That's as much as I can help you with today. If you can, hold your questions as much as possible until the appropriate time to ask them so we can get them out and get it to our presenters. If you're joining by phone, email your questions to cdii@chhhs.ca.gov. You guys know that email address. And for phone call-ins, you will be muted upon entry, and then when you are called upon, you'll unmute your line by pressing *6. In the Zoom, if you can, please use the Zoom's Q&A or chat feature to submit any of your questions. One of our terrific volunteers right here will review and address your questions to our panelists as time permits. And finally, the host has enabled, I guess we've enabled closed captioning. But you must also turn on the feature on your individual computer. So go ahead and click on your settings and click Accessibility tab. And under closed captioning, click the checkbox to enable Always Show Captions. Adam.
Awesome. Thank you for that key information, John. While we may have a large audience today, what's really important is we want you to be engaged.
Let's do that.
So we're introducing a new platform called Slido this year to offer live interactions for our attendees. You're going to see in just a second here a QR code on your screen that you can scan with your mobile device to join, or if you'd rather, or if you're on a computer that you want to use, go to slido.com, SLIDO.com, and enter the access code 6638910.
All right, so let's do that. Let's give you guys a second. Get into Slido. I'm going to do it right here. Here, you want to take that for a sec? Our first question's an easy one. Let us know what department or office you're representing today. Just type in the name of your office or department. You can use the appropriate acronym too. We'll take all of that. We want to see which department has the most attendees. Maybe that's not fair because there's bigger departments, but that's okay. CDSS is a big, strong player. It's like little races going on here.
HCI,
DDS representing DMHC.
Moving up.
Oh yeah, here we go.
DHCS popped up for their second. I know you've got a bunch of folks on DHCS. Let's get those phones out.
Look at all these groups.
There's a lot of groups.
Yeah.
See, we got some duplicates. California DHCS is in there too. We're going to have to loop those together.
Yeah, and don't worry. I think, what is the attendee count at now? We've got about 200 in Slido. How many at the? 600.
Get on your phones. Get in Slido so we know you're here.
Let's see if we can hit 1,000 this year. It'd be great to have 1,000 folks for the Data Expo.
I like that.
Awesome.
And we know people are going to be joining throughout, so don't worry. We'll check back in and make sure how those numbers are doing. But get your department's numbers up. We want to see your folks.
All right. That was great.
So send an email to your coworkers. Let them know how much fun you're having. Bring this enthusiasm throughout the day today. Hopefully you're feeling it like we are.
Excellent. So today, let's get to today. We're going to explore the various facets of data, from its ability to tell compelling stories to its role in policymaking and interoperability. And we're really fortunate today to have a lineup of seasoned experts and agency leaders who are going to guide us through this journey, shedding light on a range of captivating topics. We're going to start by examining how we can use storytelling through data to make complex, informing, engaging, relatable, and memorable. We want them memorable, absolutely. We want to know the stories that we're telling, and let's go in. So we're going to delve into strategies for turning data into policy next, discussing how data can drive and inform decision making.
Absolutely, but it doesn't stop there. We're also going to focus on agency equity initiatives to understand how data can and is being used to promote equity and building a bridge for change throughout CalHHS programs and services.
And then finally, we're going to touch on data sharing, a topic that's key to fostering collaboration and promoting transparency, but also raises important questions about security and privacy.
As we navigate through these discussions over the next 3 hours, we've also integrated some audience engagement tools, as you just witnessed, and we encourage you to engage, ask those questions, share your insights. We want this to be collaborative with all of us. We know it's different than when we were all in person and you could just shout it out or talk to your neighbor. We still want that engagement with all of you. Because after all, the beauty of data is really in the discussions it provokes, the ideas it sparks, and the change it can inspire.
Awesome. So now, without further ado, let's dive into our overall theme, the importance of storytelling through data. Please give a warm virtual welcome to our keynote speaker, CalHHS Secretary, Dr. Mark Ghaly.
Good morning, Data Expo 2023 participants. I'm Mark Ghaly, Secretary of California Health and Human Services Agency, and let me start by just saying I'm sad I'm not there with you. Glad I could be here with this recorded message to both thank you and encourage you for today and for the days, weeks, months, and frankly, years to come as we continue on this journey at CalHHS to unlock the power of the information that all of you help produce and hold that demonstrate the impact of our programs across our departments and offices. And it's a real privilege to continue down this journey with you. Let me start by saying I love this year's theme about how do we use data to tell a story. I've always been a believer that storytelling is one of our most impactful ways to communicate with our teams, with our constituents, whether those are the people we have the privilege of working with and serving in community, or whether it's the legislature or the governor himself. And this notion that data helps tell a story, that every data point is a character in a story, if you will. And some of those data points are supportive of a point of view, and others demonstrate a lack of support of that point of view. And I will tell you that the most impactful mentors I've ever had, frankly, medical anthropologists who made a business in understanding the connection between those social dynamics, the data that happens throughout community, and bringing it together to tell a compelling story of need, resolve, and frankly, change the direction of global health. Some of those mentors that I've had the privilege of learning from over the years. And when I think about the work of CDII, the work of your data experts and data analysts throughout our departments, really what they are our earliest storytellers. They find the stories in the data. They confirm the stories that we want to tell. They help us understand if it's a story of success or if it's a story of challenge and a need to tweak. And as every good storyteller knows, you need a compelling set of positions and plots and twists here and there. And our data can help assist us in making sure that story that we're ultimately telling is one that is not just clear and convincing, but that one that really does change the direction that we go in. And so as we look at the opportunities across CalHHS to use the data that we have today, to start looking for the data of the future of tomorrow to help tell our story, whether it's a story about improved health outcomes, closing equity gaps in social services, or delivering smarter, better, more cost-effective, more meaningful services in any one of our other departments. I know that today's conversations, the panel that follows my short introduction, is one where I urge you all, I challenge you all to find the opportunity to tell a story, to find ways to thicken the plot, to understand how we might communicate in a more compelling, more descriptive way through the use of the data that we have, or identifying those data gaps that we look forward to filling through our ongoing work. Let me just also take a moment to say how important it is that we work on our storytelling through data. It is exactly that storytelling that helps our leaders go to a hearing of the legislature to tell exactly what we've been up to and how we've been doing. There is no better way to tell that story than through the lives of those we serve. And the stories of those we're serving are better told through the data and the information about those individuals, their families, their communities, so that we can continue to make a compelling case for what we do at CalHHS. It's no accident that we've increased the size of the CalHHS budget over the past 4 to 5 years by nearly, I believe, above 60%. Pretty incredible. And that has only come because of our ability to tell the compelling stories of those we're serving and the need to do more. So as you go through today, as you go through your week and month and plan for how we're going to meet our charge over the next months and years, I encourage you to use the thoughts and ideas of the day on how we use data to tell a story and apply that in the work that we do every day. And let me just wrap by thanking you all for your ongoing service of California, of this incredible agency. We are only as good as we are because of you, because of the energy you bring, the sacrifices you make to do this work, and the creativity I hope you feel is fostered wherever you are throughout our organization. And hope to hear good reports of the rest of the day, and just deep, heartfelt thank you, and enjoy the rest of your summer.
Wow. Thank you, Dr. Ghaly, for that incredibly inspiring start to our Data Expo, and really wish that you could have been here in our studio with us today, but we truly understand how busy you are. We are now excited to introduce to you Ross Lallian and Melissa Stafford-Jones, who are going to be continuing this great conversation about the importance of storytelling. What I'd love to do, good morning, both of you. What I'd love to start, maybe Ross, you could start and just tell folks so that they know, just a quick summary of the project that you're working on and your area you're working on. Thank you.
Good morning, everyone. I'm Ross Lallian, and I'm the Chief of Research with the California Department of Aging. And for me in my shop, the MPA, their Master Plan for Aging, the MPA, drives all of the work coming out of my shop. And the MPA is a really important blueprint for the state to deal with changing demographics, because folks are living longer, and projections show that life expectancies can continue to increase. Racial net they can make of our state's changing. Just by 2030, just a few years away from here, one out of every 4 Californians will be over the age of 60. So the Master Plan for Aging is based on 5 bold goals. And the first ones are around housing and affordable housing supply, and monitoring that and increasing that supply. Also, health reimagined, that's equitable access to health care for everyone, regardless of income level, citizenship status, whether or not you live in a rural community. Also, keeping folks in their communities and homes for as long as possible. The third goal is around isolation, and that's a key topic that impacts everyone. And so for older adults, it's important that we ensure that we have enough volunteer and employment opportunities for everyone. We want folks to feel connected. However, 2/3 of older adults reported age discrimination as a challenge. The fourth goal is around the workforce, caregiving workforce. That's critical, both the paid and unpaid caregiving workforce. I think this hits home for a lot of folks. 5 million Californians take care of a loved one, whether that's a parent, a spouse, a sibling, a friend. So ensuring that we're providing support for caregivers is critical. And the fifth goal is around economic security. And that's important because retirement income is being outpaced by cost of living, housing, healthcare costs, et cetera. There's high rates of poverty among older adults, especially folks of color and folks who rent. And a really heartbreaking piece of this issue is that the over 50 population is the fastest growing population of the unhoused population in California. So strategies around ending homelessness and barriers to services must be effective. So it's a very broad plan that touches many different important topics for the state. An important work stream for us is developing Master Plan for Aging key outcome measures. And so the purpose of these outcome measures is to basically track progress being made around these goals. And we can't be successful without working with a wide range of stakeholders. We've been working with state partners, folks at the local level, philanthropy, academia, to understand what data sources to leverage, where the gaps are, and how to set appropriate targets. We've been thinking about how to be transparent with the MPA-related data, so the data dashboard for aging. That's a public website that serves as a central location for data around the MPA. That's another important work stream. The last work stream I just want to mention is around data collection. Because it's important for us to collect data from all Californians to tell the story of California, and that includes historically marginalized communities. So we're getting ready to launch a survey that will be administered to the older adult LGBTQIA community. This is a first of its kind state-level data collection, and it's critical to collect data from those folks to tell the story of the community, then also impact program and policy design. Thank you.
Wow. And there's like a broad story there, and then each one of those seems to have a story within it.
Absolutely,
So
yeah.
that was fantastic.
you.
Melissa, I'd love to hear about what your work is doing.
Sure. Good morning, everyone. I'm Melissa Stafford Jones. I work at the California Health and Human Services Agency as the director of the state's Children and Youth Behavioral Health Initiative. And the Children and Youth Behavioral Health Initiative is part of the governor's master plan on kids' mental health, which is a multi-initiative, multi-year, multi-billion-dollar effort to really transform the way we support well-being and mental health for our children and youth in the state. And the Children and Youth Behavioral Health Initiative is at the core of the governor's master plan on kids' mental health. It's a 5-year, $4.7 billion initiative to really think about how do we reimagine and then build that reimagined ecosystem of services and supports for children, youth, and families to improve well-being and behavioral health, including both mental health and addressing substance use for our children and youth ages 0 to 26. And the initiative is really aiming to reimagine that ecosystem in a way where we are building a system that is more coordinated. We know our current systems are very siloed, which creates a barrier to children, youth, and families getting access to the services and supports they need, to creating a more youth-centered system, a more equitable ecosystem. We know we have inequities both in terms of the outcomes of behavioral health for our children and youth, but also in the structures that support well-being. And then lastly, we're working across the continuum of services from thinking about how do we support positive mental health all the way to how do we improve access to services in a more integrated way for our youth with the most complex behavioral health needs. But while we work across that continuum, we are really focused on how do we build a system that is more prevention and early intervention oriented. Something we hear consistently from our partners, both those who are practitioners in the system and youth and families, is that we often wait longer than we should in order to really wrap around and get the services that families need. So how do we work across that continuum but really focus on preventing and intervening as early as possible? And core to this work is meeting youth and families where they are. In addition to being at home and with their families, we know the other place that children and youth spend a lot of time is in education settings, whether that's childcare and preschool, K through 12, or higher education for our older youth. So meeting kids where they are in those settings, which means partnering and collaborating between health and behavioral health systems and the education systems, is really part of the core work of the Children and Youth Behavioral Health Initiative in order to build that more coordinated, equitable, youth-centered, prevention-oriented ecosystem that we're striving for.
Wow, that's incredible. I feel like this could go on for an hour, but we're gonna jump into a couple things. So with all these conversations, right, the first session, we're talking about storytelling. So Melissa, first to you is, how are you looking at data and storytelling to advance your work?
Yeah, so we are really trying to take a combined approach of using quantitative and qualitative data. In terms of storytelling specifically, we have a couple of different strategies. One is literally a series that's called Stories from the Field. And this was really coming out of, we're not starting from scratch, of course, in the work of the Children and Youth Behavioral Health Initiative. We have incredible examples already happening in communities of the kind of work that I was describing in terms of the system we want to build. But what we know is challenging is making those bright spots systemic and scaled and sustainable. But we wanted to really highlight those stories from the field that are representative of the values and the focus areas and the goals of the initiative. So we have a series, Stories from the Field, that highlights different collaborative partnerships between health and education, that highlights the stories of youth, actually, that we've learned through different work we've done in communities engaging youth and families. Our second is that work that I just mentioned. We've done really deep work in the Children Youth Behavioral Health Initiative to talk directly with children, youth, and families, including through trusted partners, to really hear their stories. And not just to hear those stories, but to absorb them and try to take them in to impact our work. So we have a report called Youth at the Center, which you can actually find on our website, that is 12 calls to action from youth, families, and communities about what they want and need out of the behavioral health ecosystem. And I'll give you just one small story from that, which is, for example, youth were very clear. They said, please stop waiting until I'm in crisis to provide me with support. That came directly from youth. A third is we're working on a set of youth journeys to describe what we hope youth and families' experience will be once we have implemented the major components of the Children Youth Behavioral Health Initiative. It has 20 components in 4 focus areas. We want to help translate what the goals are. We have 15 outcomes goals. We're working on baseline data now for those, but we want to translate that into a storytelling mode. So we're going to be using these youth journeys to describe what our goals are through the experience and the eyes of a youth. And then the fourth is our evaluation partner is Mathematica. We chose them through a competitive process, and we are really working to combine quantitative and qualitative work, including hearing directly from youth and families as part of our evaluation process in order to allow us to learn along the way and not just have a white paper that comes at the end of the 5 years of the initiative, but to use storytelling and the experiences people are having over time to help us learn and deepen our work.
That's incredible. Awesome. Ross, do you want to add ways that maybe are incorporating storytelling?
Absolutely, yeah. So I think storytelling is an opportunity for us. It's an important opportunity to make things easier for our colleagues, our consumers, our stakeholders to understand data. And as a public servant, I think it's our responsibility to keep things simple and effective and make it easier for our customers to understand what they're looking at. I think a consumer should be able to go on our website, look at a visual and understand it within seconds. So at CDA, we're trying to make things easier for consumers. Our data dashboard for aging, that's our opportunity to showcase some of our data. And we try to keep things consistent so it's easy for consumers. I'd like to share an example, John.
Yeah, please.
This is related to actual equity data, because equity is at the core of what we do with the Department of Aging. And I think it's at the core of what we all do for Health and Human Services. And so it's important for us to be able to share data and findings around equity for our consumers and do so in a way that adds value. It makes it easy for them to understand. And so I wanted to share an example of what we're doing with our data dashboard for aging to tell that story of equity through data. So currently we make a lot of demographic data available for our consumers, and folks are able to kind of customize their view of data and pull in whatever data the elements they want. I think that's really useful for researchers and policy folks, but maybe not as useful for folks who want a quick takeaway, make a quick comparison, or somebody who doesn't work with data on a daily basis. And so my colleague Evan Wallace, he's been working on this concept of an equity index. And essentially, we would like our consumers to view any indicator on the data dashboard and quickly understand where there's inequity or not. And so we have this example here, and there's several different equity topics there. The higher numbers indicate more equity within the topic. The lower numbers indicate less equity or more variation between the groups. The scale is 1 to 100. I think that's important because that makes it easier for the consumer. We're generally used to that type of scale as opposed to a -1 to 1 type of scale. And on the example here, which is related to older adults with the usual source of care, we called it education, and that has an index score of 90. And the call out there shows some more detail. As you can see, across the different levels of education attainment, generally the groups are pretty similar. The range is between 93 to 96% of folks have that usual source of care regardless of education level. But that's much different than the topic of language. And you see the call out on the bottom right there around language. And we see more variation there. Only 80% of Spanish-speaking older adults have that usual source of care compared to 96% of folks who speak English. So John, we're trying to make these data easier for folks to understand. It's complex data. We want that quick takeaway, and this make it simpler for folks to have that quick takeaway and hopefully tell that master plan for aging story.
That's really helpful. So I'm sure that a lot of people are hearing this incredible work that you guys are doing, and we know that things don't come easy. What kind of blockers are you running into? Where are the areas that are toughest to kind of break through, and what have you done to mitigate that, I guess? Either of you could take that one. We'll see, you want to go?
I'll start.
Okay.
I actually think for me, one of the biggest blockers, candidly, is time. I think doing the work of really thinking about how do we authentically bring in the stories of our consumers and our partners from the field, so that these are not stories that we're using candidly in an exploitative way, right? That are really, we are building relationships and honoring the trust they give us by sharing their story with us, thinking about how we combine it with the data. I think really does take a time, a relationship, a thought, a partnership. And for me, I just think one of the challenges, there aren't enough hours in the day, and yet we want to do more of it, and we want to do it meaningfully.
Thank you.
I think collaboration comes to mind.
Okay.
The culture of collaboration is probably the best way forward. We see that with data more and more in the statewide data sharing agreement. That's a really good example. We could always use more collaboration to come together, understand what our needs are, the different benefits. We can create better products that way. And I think that'll also lead to more data sharing, and I'm always an advocate of that, safely and securely sharing data as appropriate, making easier processes to share data. And I think that'll lead to this culture of information sharing. And I think as a state, if we have that type of culture, it'll unlock so many insights for the people of California.
Awesome. I'm going to just turn to our studio real quick and see if there's questions that have come in the chat. Do we have questions for our panelists? If not, I'm going to jump to the next one. None? Okay, that's okay. So I think about our data community, and a lot of the leadership that's listening is, are there call to actions that you have for folks that are listening? And then also, are you willing to accept those calls to action when folks are saying, I'd like to talk to Melissa or Ross a little bit more about that? So, Ross, you want to?
Absolutely. I would love to connect. I think this shepherding that forward to collaboration is critical. A piece of advice, John, is when I get out there. Keep things simple. The visual you're working on, the story you're telling, doesn't have to solve everything. This needs to be effective for the point that you're trying to make. So just keep things simple, and simple for our consumers, I would say. But as far as leaders, to shepherd that culture of collaboration, I think that's critical.
Excellent.
Yeah. Yes, I'm so excited to be on this panel with Ross, because I can guarantee you, this happened to John and I a few years ago when we first met. We started partnering, collaborating by being on a panel together. So yes, if anybody wants to reach out, I would love to learn about the ways in which you are combining quantitative and qualitative data and storytelling to really accelerate and launch forward the goals and the impact that you're trying to have in your work. We're trying to do the same, and I feel like it's a constant learning effort. So looking forward to collaborating more with Ross as well. I think the one thought I would share around sort of maybe how to incorporate or think about some of this work is part of it is, as we are hearing people's stories, that we're not just using them to maybe accentuate a point that we might see in quantitative data, but we're actually taking in and allowing these stories to become a part of the change we're trying to create. So really, how is it that these stories might challenge us to say, this work we're doing, the shape it's taking, the decisions we're making, the way we're structuring this grant program or this policy might need to shift based on what we're really hearing from people's experiences. And I do think that's a challenging process, but I think it's really an important part of our work in terms of engaging with our partners and communities to hear their stories. Awesome. It's also part of the honor of the work to really have people share those stories, and then to be able to work with them as well as with other experts in the system to think about how do we create change that will meet the needs and build on the strengths of our partners and communities.
Awesome. Ross?
I think that qualitative data piece, I want to piggyback on that. That's critical, because quantitative data is what I kind of tend to go towards, right? But qualitative data helps fill out that story, brings out that human side. So that's really powerful, Melissa, blending qualitative data with quantitative data for storytelling. I think that's critical. And so, as you know, when we create outputs for the public, we're not there to talk them through it. I think the qualitative data helps with that, making really powerful visuals, helps tell that story for consumers. So.
Awesome. Well, we only have a minute or two. Any final thoughts or anything else you guys wanted to share with the group? Not to put you on the spot.
Keep it simple and effective. That's all what I'd say. Keep it simple. Stay within scope. And it's challenging to stay within a defined scope and keep things simple, but at least to a better product and easier product for our consumers to understand, which I think is most important.
Awesome.
I think I would just close with what we really heard from Dr. Ghaly, right, which is storytelling is so powerful. And so for us, I know everybody is constantly working so hard with like their heads down with all the work that has to be done, but the power of pausing and be able to tell a story, whether it's from the data or whether it's from a person we had a chance to interact with in our work, whether that's a colleague, a practitioner, in my case, a youth or maybe a family member or somebody that is interacting with the program that you are working on. Taking that time to reflect on those stories and really think about how they can help shape our work, I think is just, it's both an honor, but it's also really a powerful tool for the change I know we're all working so hard on.
Awesome. Well, speaking of the word honor, thank you for honoring us with your time, with your expertise, and your talent, and sharing in front of all of our group here today. So thank you very much, and thanks for kicking off
Thanks
our
for having
Data
us.
Expo with a great
Thanks for
first
having
panel.
us.
So I'm going to switch over to Adam.
Thank you, John. And I mean, wow, truly inspiring. Thank you, Ross, Melissa. Thank you to Dr. Ghaly for taking the time to share with us. We're seeing firsthand right here how harnessing the power of data storytelling can truly revolutionize policymaking, providing a stronger evidence base and paving the way for more informed, effective decisions. Data is even transforming operations right here at CalHHS. And this year we've added a new component to our Data Expo that I'm really excited about. I hope you love it as much as I do. The Department Spotlight. Throughout the next few hours, we'll be introducing a handful of CalHHS departments and teams that have found innovative ways to leverage the power of data. Since the Data Expo is all about sharing successes and lessons learned, we want to share how all of you are changing how we use data here at CalHHS. Our first Department Spotlight is the Department of State Hospitals. Let's take a look at how DSH is using data to improve access to treatment for individuals found incompetent to stand trial and committed to DSH for treatment and care. Here you go.
The 2023 Data Expo is proud to present the Department Spotlight. Our first spotlight is on the Department of State Hospitals, whose mission is to provide evaluation and treatment in a safe and responsible manner by leading innovation and excellence across a continuum of settings. DSH is working to significantly increase access to treatment for individuals found incompetent to stand trial on felony charges and committed to DSH for treatment. Their focus is to develop a continuum of care that expands beyond the state hospitals and includes community inpatient and outpatient treatment. To support this programmatic statewide growth, DSH's data vision had to swiftly pivot to focus on the build-out of data pipelines across all programs involving standardized data collections across providers and provider networks. DSH currently holds more than 150 contracts with county or private providers across all programs, with significant expansion plans on the horizon. This vision, already underway, requires the integration of all statewide programs to an enterprise data platform and DSH's centralized referral intake system. This integration will allow DSH to link all patient records across all services, improving transfer and accessibility to clinicians, thereby ensuring continuity of care for individuals served in these programs. The data standards, governance, and integration will allow for continuous advancement in program evaluation and assist in generating greater data insights. So a big thank you to the Department of State Hospitals for all the great work that you're doing.
Well, congratulations to the Department of State Hospitals. That's awesome. What a great overview of the data work that they're doing. And, you know, as Ross and Melissa and Dr. Ghaly already shared, data is the backbone of the modern decision-making and storytelling. Data also plays a pivotal role in shaping our world, especially when it comes to policy making. To start off our next segment, turning data into policy, we're going to explore the potential of data in transforming policy making and creating positive change. We're fortunate to have a panel of esteemed experts who will guide us through this complex yet important process. Back to you, Adam.
Excellent. Thank you, John. Really an amazing panel we've got for you today. You're going to absolutely love this conversation. Let me just start by letting them introduce themselves and the department that they're with. Mike?
Thanks, Adam. Michael Valley, Deputy Director for the Office of Information Services at the California Department of Healthcare, Access, and Information. My office's mission is to support informed decisions in healthcare through data transparency, analytics, and public reporting. I see ourselves as the clearinghouse, reference library, almanac, authoritative statistics around healthcare data to support HCI's mission and all CalHHS departments' mission with actionable data.
Thank you. Barna?
Hello, everyone. My name is Aparna Ramesh. I'm the branch chief of the Research and Data Insights branch within the Research and Automation Data Division within the Department of Social Services. You've probably heard of RAD. And so our team does exactly what the title says. We take data, we turn it into research, and we turn it into insights. So really proud to support the whole department with a team of formidable researchers, dashboards to surveys to state and federal reporting to program evaluation.
And they are indeed rad. Dr. Scott?
Thank you. My name is Lynette Scott. I'm the Chief Data Officer at Department of Healthcare Services and Deputy Director for our Enterprise Data Information Management Organization. It is a fantastic organization, fantastic department that I have spent 11 years at now. Really appreciate the work that we're doing across the organization. So EDIM, our Enterprise Data Information Management Organization, is relatively new the last couple of years, and we've been really working to build out our capacity around our data analytics, very much like Aparna and Mike's team, with data analysis, program monitoring, evaluation, reporting, data insights, data visualizations, data management, and everything in between. Department of Healthcare Services, as many of you know, serves our Medicaid program, which we call Medi-Cal. But it's not just Medi-Cal. There are many other programs that we provide and support throughout the department to serve Californians and provide health services. One of the things that's super exciting, and we'll talk more about, I'm sure, is some of the transformation that is happening within our Medi-Cal program, incorporating health-related social needs and all that goes with it. So really happy to be here and be partnering with this fantastic panel. Thank you.
Thank you. Really excited about this conversation. Turning data into policy. It's an interesting statement, somewhat straightforward, but at the same time, what exactly do we mean by that? So maybe if I could turn to each of you to share a little bit about what that means to you and how your department works together collaboratively to do that, because I know none of us can do that on our own. So maybe we'll go backwards, and I'll jump back to you, Lynette.
Oh, thank you. Data into policy. We absolutely want to be a data-driven organization. We were chatting a little bit earlier. This is our 9th Data Expo, so we've been talking about this for a while. And admittedly, when we started the Data Expo, it was all about getting to, yes, let's make sure we can actually share data. Now folks kind of take it for granted almost. So what does it mean to turn data into policy? Data is robust, it's rich, but unless we can understand and interpret it, it doesn't do anything. So one of the things that we have really tried to do is think about, as the previous panel talked about, how do we tell stories with data, and how do we use that to inform decision making? So data definitely drove a lot of the work we're doing today, recognizing that we need to provide better services to our members, that we need to engage with our members, and that our partners, our plans, our counties, everybody we work with to do so is part of that. So we are working very hard at taking data, making it understandable, and then telling a story with it. And I think we'll highlight some of those examples as we go forward.
Excellent, thank you. Aparna?
Yeah, I'm about to drop some knowledge on everyone. Data don't make decisions, people do. And so when we talk about data and its role in policy, to me, it's really about what's the underlying decision we're trying to influence and inform, and really understanding the purpose of the question, and then thinking about, and sort of the demand side of data. And so I think a really big part, and maybe a shift in a lot of the role of data and research teams today, has been not just cultivating the supply side of data, right? So like making sure we have good data assets, producing good research, high fidelity research, but also driving a conversation about like what can you actually do with the data, and what do you want to actually know from your data. And so I think to me and to our teams, a lot of our role is not just producing the research, producing the data, but having those conversations of, what do you want to learn? Even when we're talking about like a statutory mandate to do a report, like what's the underlying purpose of it? Where can we extend this beyond a compliance exercise to really sort of drive a decision? And that starts at the beginning with defining a good research question, and it happens throughout the project towards the end, which is, okay, we have results, so what? What do you actually do with it? How do you turn it into insight? So I think there's been so much investment in the supply side, and it's really exciting to be in a position and in a moment here where we're actually thinking about, okay, what do we do with the data? How do we actually make decisions with it?
I love that. Really powerful. I mean, truly, so often we just do what we were required to do because someone said to do it, and taking that moment to stop and think about the purpose and the why and actually getting value out of it. That is really powerful. Thank you. Mike.
Well, I also like thinking about the people side of it. And in our role as a public transparency and public reporting organization, I think of bringing data to make policy action as bringing some sort of shared truth to the public debate and to the policy discussion. Some evidence or facts that are trusted. In policy, there's a cycle, if you will, policy design and implementation and evaluation. And I think data can be important to each of those steps in the cycle. And there's so many critical and urgent needs facing Californians that we need government to act and create policy and create programs. Even if there's an absence of data, how can we build in the data collection, data management, evaluation processes that are robust and sound so that we can evaluate the efficacy of those programs over time? And I think doing that in a way, again, that's credible brings some level of trust from stakeholders and from all members that are participating in the policy discourse. At HCI, we have a little different of a structure. So analytics, data, and technology are all organized within the Office of Information Services. And so that's really important for our organization to align resources around shared priorities. We also have a product portfolio mindset that we bring to data analytics projects, trying to understand the goals and the objectives, understanding stakeholders' input into that, and having an iterative approach to improving those data analytics outputs over time to be as relevant and actionable and timely for the policy debate of most important.
Excellent. Thank you for that. So I think maybe I think all of you kind of mentioned some examples you have recently. Maybe we'll jump into a recent example of success. Mike, I know for you, Healthcare Payments Data Program has been breakfast, lunch, and dinner for quite a while for you and your organization. But whether it's that or something else, you want to share an example of a recent success?
I'll get to the Healthcare Payments Data Program in 1 minute, but I do want to share a bit about a recent example. We have a data storytelling template that when we post public reports, we follow. We have about 50 public reports on our website, and we can share the link in the chat, hcai.ca.gov/visualizations. We have 50 on there now. We're publishing more every month. And we follow a template that has structured components to it on this webpage for public consumption. So the top are key findings, and we have digestible, easy to understand language about what you should be interpreting from the data, including a pull quote, which is sort of the headline for the data story. Then we have an interactive data visualization that allows you to do query-based analysis on the data. All of those data sets, we house the underlying de-identified data on the open data portal, so you can recreate our analysis, perform your own analysis. We show our work with that. And then finally, the fourth component is structured metadata that is modeled after the open data standards and robust documentation around that. So we put that information out there again to be able to have this trusted, credible backdrop to the information we're producing. So I get a call to provide some data. There's a high-level, state-level policymaker that's going into a policy discussion in 15 minutes with other state leaders. And the question is, Mike, do we have any data on this topic? The topic was youth behavioral health. And this was 15 minutes before this policy discussion was about to begin. So after a moment of brief anxiety, I was reminded that the team recently published information about emergency department encounters for people experiencing behavioral health conditions. So I was able to go to the website. We had those key findings broken down by demographic categories, including age. So I copy and pasted these already vetted, pressure-tested key findings, put them in an email with a link to the data visualization that would allow further analysis, and sent that off, and that was used in that debate and met the need of timeliness for when those policy decisions are being made. So I think that's an example of success. I'd love to be able to follow up and understand what questions were not able to be answered with our data, and I'm sure there were many, and try to use that in an iterative way to inform the next iteration of this project, this data product, and what else we could add to help inform the policy discussion. But regarding the healthcare payments data program, I know Dr. Scott wouldn't let me out of here alive if I didn't make mention of it. She's a member of our advisory board, and one of the responsibilities of all board members is to be a stalwart champion for this program. We're very excited about it. This is California's all-payer claims database. We call it the Healthcare Payments Database, HPD. We're just getting started, but we have our first core data set of about 4 years of historical data from all payers. This includes over 5 billion healthcare claims and encounters across all settings and cost information there as well. So we've published our first public report from this program. We have 2 others that we're scheduled to publish this year. And then starting next year, we're going to open a data access and release program for other organizations, state entities, researchers to access the data. So I'm hesitant to claim policy success quite yet, but certainly this is a resource that we hope will be very informative to policy discussions for years to come.
Amazing examples, amazing work. HCAI's living in the future right now. That's great. I love it. Aparna, you want to share an example?
Yeah, sure. And I just want to say, I love the example you gave because it sort of points out that you need to invest in sort of collecting the evidence and building the data. And then there's this policy window or this moment that hits. And then it's that 15 minutes where you can drop the report, you can synthesize it really quickly. And I think, we were talking about what data, turning data into policy. What does data mean? To me, it's not just the data that we all collect and aggregate and put in dashboards, but it's really sort of the research and some of the underlying evidence behind many of the policies and programs that our departments support. And so investing time in trying to build out what that evidence base is and what we know sort of collectively about what's working and what doesn't, building sort of like a clearinghouse of what we think works is also really important exercise, and it's one that I'm really excited that we're also trying to push forward within our own department. But I'm going to take a slightly different tact on turning data into policy. For us, I think the most immediate way, and I think this is true for many of the departments within CalHHS, that you can influence policy is by actually delivering a service or benefit via data to an individual and a Californian. And so I think there's some pretty cool examples from our department over the last couple of years, especially during the pandemic, where we just had this massive increase in the safety net. And there was a question about how to get benefits out fast to people in need. And so 2 examples come to mind. One is our pandemic EBT work, in which we were trying to deliver billions of dollars in benefits to school children in need all across the state. And instead of sort of having this application process and sort of trying to get people through that process and then deliver a benefit, the model sort of turned on its head and said, okay, can we use the existing administrative data to basically automate out who can receive these benefits instead? We're talking $8 billion delivered as a result of that. I don't know, if we had an application process and we weren't using our administrative data in this way, I don't know how much less dollars would have been delivered, but certainly it would have been less. And so that sort of was a springboard, I think, to thinking of this interesting new model of can we take, we have really good data in our department of who we're serving. We have less good data on who we're not serving, but may be in need of some of our programs. And so, again, during the pandemic, a really big part of the safety net, we administer CalFresh, CalWorks, were tax benefits and tax credits. So the earned income tax credit, the stimulus payments, the child tax credit, thousands of dollars that are being delivered. And in order to get it, you had to file a tax return. And it turns out that roughly 30% of our caseload hadn't actually filed a tax return in order to get those dollars. And so what we were able to do was, through a data sharing agreement with the Franchise Tax Board, link that data together and figure out who wasn't receiving these benefits and how to actually sort of connect those individuals to those benefits. The result was, I think, for every dollar we spent in communications and to sort of direct outreach, we delivered $10,000 in benefits, which is pretty good ROI. And so really sort of thinking about how the administrative data can serve the people, and sort of turning it back to figuring out where the need is, what the problem is, and then using the data to actually test a solution, see if it works, and then iterate on that again. So almost like a CQI process, which is really exciting.
Great example and the real world immediate impact that you can have
Yeah.
with that work. And a huge heartfelt thank you to all the DSS team, truly during the pandemic, the work that was done. I mean, you can't overstate how much they did to support the people of California during that time. Lynette?
You know, there's perhaps so many examples. As I've listened to Mike and Aparna, I had something in mind and then I thought of other things. So maybe to touch on two, kind of from the COVID experience, right? One of the things that we were able to do in terms of turning data into policy was, as we got to that stage in the pandemic that a vaccine was developed, everybody was really excited. This was hope, this was opportunity. And so our partners at Public Health started delivering the vaccine. And as they did so, we learned very quickly that our typical administrative data, our claims data, was not going to work, because the community, so many entities were delivering the vaccine without charging. And so the only way we could see it was if there was a charge for the administration of the vaccine, and it wasn't coming through. So we very quickly realized we had to link our data with CDPH's vaccine data. By doing so, we were able to then get a better picture of who in the Medi-Cal program had received a vaccine and who hadn't. And what we saw was consistently our population was less vaccinated than the state as a whole. So as a department, we then took that, having our leadership had conversations across the agency and legislature, and there was an investment made to really invest with our managed care plans and our other entities and partners to do that outreach to get our population and our members vaccinated so that we could get closer to returning to the new normal post-COVID. So that was a really exciting way of seeing how data directly drove the development of a program, the implementation of a program, and then monitoring it. And we actually continue to post that vaccination rate that compares the state to the Medi-Cal rate on our public website. So that's kind of one example. Another example more recently, as we've been coming out of COVID after the immediate emergency, we've had the opportunity to implement and begin really implementing CalAIM, so California Advancing and Innovating Medi-Cal. And as part of CalAIM, kind of like Children Youth Behavioral Health Initiative, there's a whole bunch of initiatives. There's a bunch of work streams. There's lots and lots of dollars. And there's lots of impact on the people that we serve. And so as part of that, two particular benefits. One is our enhanced care management benefit, and then community support services. These are new services that started in 2022. And they really meet people where they are. So they allow us to do things like help people getting into housing, help looking at asthma remediation, helping to make sure populations, people with higher needs, whether they were involved with the justice system or have complicated medical conditions or have other kinds of needs, we're able to wrap more services around them and support them. So we just last week issued our first annual report to show how it's going. So I think we're going to drop a link into the chat for the Enhanced Care Management Community Supports Report. And this was an exciting report for a lot of reasons. You know, first and foremost, being able to demonstrate that people are receiving these services and they're telling their stories. So part of the report is an embedded story from one of our members and the benefits they received through this program. But it was also something new that we did for the department. We used story maps, so an ArcGIS Esri product that helps do kind of what Mike was describing with the visualizations in terms of having text and telling the story, but having embedded graphics to help have that data go along with it and then be able to put those pieces together. So we're super excited and super proud from a data team perspective that we were able to to support our programs and our policy leaders in being able to provide this information to all of those who have been working with us on it. It was a really huge lift and super exciting. Again, that's fresh off the presses as of last Thursday. So, so giving it a little attention. But it is exciting to see how far our departments have come in terms of telling stories and making data available.
That's great, thank you. I mean, these examples, these are emotional examples for me, right? Hearing the work that we've done. And if you haven't checked out the CalAIM, there's a whole section of DHS's website dedicated to CalAIM. It's worth looking at. I mean, truly groundbreaking.
Yes.
What California is doing here and what DHCS is leading. It's very inspirational. All right, I'm going to do what you're never supposed to do on live recordings. I'm going to call an audible here, move from our question. You've talked about the dramatic change. You talked about open data portal. On our way in, we realized that Dr. Scott and Mike and myself were here at the first the first Data Expo 9 years ago, Department of Social Services. I think there are people in that room right now. Hopefully they've gotten new tables for you. But I wanted to just say with those comments, back then, open data portal was the dream. All right, to just even imagine that we might be able to get there, and now it's an undercurrent. It's there. It's being used. It just happens. It's not even the forefront of conversation. I mean, the change, how far we've come is dramatic. And so I just wanted to maybe turn to Mike and Lynette. Just any thoughts you have about that dramatic change for folks who maybe haven't witnessed it and are just living in the future like your team.
Well, I don't know that we're quite living in the future, Adam. I mean, I think I would say there has been a change. I think the data community that all of you are a part of is stronger than ever. I think data sharing is more robust than ever, and I think the just acknowledgement around, again, for me, a lot focusing on public transparency and our role as government organizations to be accountable to the public, and just connecting that with data. I think that's something that has emerged as a norm amongst our departments and our teams, and I think that really supports, again, data sharing, collaboration on cross-departmental research projects. I think we're really the next forefront. The true future is integrated data. And having more master data across departments. So I think we're well positioned to go from where we are now to where we are next because of the last 9 years of collaboration and partnership.
Mm-hmm. I mean, and to your point, 9 years ago, we were just standing up this idea of governance and our subcommittees. So the Data Expo was sponsored by the Data Subcommittee of the Interdepartmental Agency Advisory Council. This aspect, the Data Subcommittee, really got a chance to steward a lot of things that I think are taken for granted now, some of which we're talking about specifically today, but some of which folks don't even realize. And I mean, I look back and I remember Mike Wilkening, he had a couple different titles during the time, but he talked about his transformation of when somebody said open data and he said, no way, and he pictured breaches and microfiche on streets and stuff like that and said, But the transformation happened, and it was really fascinating. We learned a lot from New York, actually. And New York had an example after a hurricane. They had started with open data, and they thought they started with a really not, high value per se, a quiet data set. Locations of skilled nursing facilities. And then the hurricane hit. And suddenly it was like amazing. It was the hot data set. And to Aparna's point, right? And Mike, when we feel like when we get lucky and we already have the data product out there, when the need comes up, we're good to go. But we've done a lot of work. Our teams have done so much work over the last 9 years, helping to make data ready, leveraging the open data portal, getting through the data de-identification, having consistent ways of how we define that, having data sharing agreements, which you'll hear more about in one of the next sessions. Those weren't there 9 years ago, and it was the governance structure that gave us the framework to do that. So it's just so exciting that we have folks here now that are like, well, of course, we got to do a BUCP. What do you mean? It's great, and really appreciate all of the work that's happened across so many areas of this agency to make that happen. And to Mike's point, it set us up for the next stage, the new future, as we keep moving forward. So it is nice to take a moment just to say thank you and to celebrate the many successes that we've had, and knowing that we have many more to come.
Yeah. Thank you.
Yeah, thank you, Adam.
Thank you for sharing that. We've got a few minutes left. Let me try to sneak another question in, and maybe to build off of that, for those of you that we know there's still challenges in data sharing, and for those of you that feel like you're struggling through those, hopefully you hear this and know like you are part of the journey, and we hear you, but we are making huge strides. And in a few years from now, maybe you'll be sitting up here telling us a story about how far you've helped us come. That's certainly what we hope. And so maybe if you could just each share maybe some challenges that you've experienced and what you've done to kind of overcome it. I'll start with you, Aparna.
Sure. I mean, I feel like I'm standing on the shoulders of giants here. Like I was on the outside for the last 10 years looking in, and it's sort of amazing to see the cultural transformation too, and just sort of the orientation of we all really need to be sort of breaking down the data silos to break down the policy silos and working together across CalHHS and working together across the state. Like the two examples that I brought up, it was Department of Education and Franchise Tax Board, right? And so it's really cool to sort of be in here and think about what the next 10 years looks like. Challenges. I think the thing that keeps me up at night sometimes is that report that gets posted that has an audience of one that never gets read. I remember reading a statistic from the World Bank once, like a couple of years ago, that about a third of their reports never got opened, that they posted publicly. And so again, getting back to that intentionality of, okay, if we're gonna produce something, what's it gonna influence? What's its role in sort of the policy landscape and the decision-making landscape, and really interrogating what that looks like. And it's challenging. Because it requires a lot of startup time, but I do think those investments are worth it. And just sort of keeping an eye on like how things, it's really easy to like drop a product and leave. And so really thinking about how do you do that soft handoff? How are you actually sort of saying, okay, here's a data point, here's what it means, here's what you can do with it. Let's have a conversation about where it's heading. So I think that's how we get ahead of the challenge, but I always do worry that sometimes there's just stuff that's getting produced and it's sort of a tree falling into forest. And so now that we have this robust supply of data and research, is thinking about, okay, how do we strategically invest the next 10 years on what's actually going to get used?
I love that. Thank you. Mike.
Yeah, I just really pick up on what Aparna is saying, and just trying to keep up with the speed of the policy discussion. There's so many emerging needs and emerging policy questions that I think it's challenging to balance being responsive to those while also investing in core data infrastructure and data sets that are necessary for longitudinal and trending information over time. So having discipline to commit to those and committing an investment in those longer term research projects, if you will, while also responding to emerging needs is a challenge. And I think strong partnerships, collaboration with stakeholders to try to understand their issues and to respond to them is one way to address that. And I just want to take a quick moment to thank John and the CDI team, because I think everything that the agency is doing to focus on data and shared priorities around policy that could be addressed with data is really critical. So just want to say thank you to them.
Excellent. Appreciate that sentiment. Lynette.
Ditto, and ditto, right? It's great to have different voices and to share that and know that we have the same experience and we have the same concerns. So having said that, I'll pick a different challenge. One of the challenges I think we have is that we have so much data. We have so much data, and yet Mike used the term master data earlier, I think. And it's a lot of data, but it isn't necessarily mastered or curated in a way that we can get to some of the analysis that we're hoping to do. So I'm going to do another flashback. Mike Wilkening was one of our inspirations along the way. And one of the policy drivers he wanted to be able to say was, come the next budget crisis, he wanted to know how many programs was an individual touched by. So if we did a 10% reduction in every program, how did that multiply for a particular individual? And the fact that he couldn't do that back in, I think maybe it was 2008, 2009, was a driver really in terms of breaking down the silos around having the data sharing ability, bringing that data together. So we have had a project over the last many years that we call the Record Reconciliation Project, where we brought together data from 7 different programs and linked them and looked to see how many individuals were in 1, 2, 3, 4, 5 programs across our agency. And that is on, we can drop that link into the chat as well. But that's our CalHHS program data dashboard. But we did that because we worked with a research team that did the linkage across the 7 programs, and we do it once a year to update it. What could we do if we brought all that data linked together regularly, so it's not just a point-in-time snapshot, but it becomes something that we could use on a regular basis? And that data linkage, data resolution, digital identity, there's lots of different words we use, but it's something that's definitely being driven with CDII support and AIO, OSTI support, did I get it right? In terms of thinking about how do we do that? Because right now we have researchers that spend a ton of time doing data linkage, but really being able to do the digital identity in a way that our researchers can do more of that analysis, outcomes, understanding, and interpretation. So there's a variety of challenges we have just literally in the way we manage the data, that we have opportunities. I mean, and again, the exciting thing is, yes, we do step 1, we acknowledge, but then this is an organization across our agency that says, okay, how do we work to fix it? And sometimes it takes a while, but persistence will win out, and we will get it done. So lots of opportunities, and really appreciate the fact that we're all working together in that same direction.
Thanks, Lynette. We will indeed get it done. And I think what you hear at the core there of Lynette's comments is what Mike Wilkening started in his various roles, and what you hear at the center of what Dr. Ghaly talks about and has put forward in our priorities is that shift from program-centered to person-centered. And it's really quite dynamic what that simple statement means for the way that we operate, the way that we view data, the way that we treat it. And so I think you'll hear that coming over and over again. We have a couple minutes left. I know we've got a couple of questions. And so let me look at these, and I'll say while I read them that we're only going to be able to get to one now. If you think of more questions, send them in. We will be compiling these and getting responses out to folks. Let's see, we've got, notice that often data tells us that certain policy changes will make people's lives better and save the state money long term, but cost money in the short term. Sometimes I feel like leaders hear only the second part and immediately veto important changes because of ever-present budget constraints. Not untrue. How can we use data more effectively to communicate recommendations that look forward 5, 10, or 50 years in the future? It's a great question. It's a difficult one, so I'll caveat that I don't expect any of you to have the silver bullet on this. But I'll open it up. Anyone want to kind of comment on that?
Sure, I can start. I think this is especially true of many of the programs that we at the Department of Social Services oversee, where we're giving cash aid out to individuals, and for a long time, a lot of the evidence and a lot of the data has been focused on sort of that short-term impact. And what I think is really exciting about our research team is that we're trying to keep that eye on the long-term impact. So, and it's building on all of the data sharing to really understand what is the impact on sort of like the whole Californian, right? So, if you give money to someone, it doesn't just impact their, employment outcomes, it impacts their health, it impacts the health of their children, it impacts education outcomes, criminal justice outcomes. And so how do we build investments now in our research and data infrastructure to really capture that long-term view? And so when we're talking about the economic investment in our safety net programs and our anti-poverty programs, it's not just about sort of the short term, although during the pandemic, we did see the lowest child poverty rate that's been documented in California and in the United States. But how do we sort of now extend that to say, okay, that's the immediate impact. Here's what it means for the longer term. And I think sort of there's a huge role for data and research to play in that, but it's going to take time. But my hope is that 10 years from now, we'll be in these chairs, or many of you will be in these chairs, and we'll be talking about how we sort of made those investments early on to begin capturing that long-term view.
I love that. We got about 1 minute left. Lynette or Mike, do you want to add?
We're doing the coin toss.
Yeah, I think I just agree 100%. And it is a challenge. I think data literacy is improving though amongst the legislature and other policymakers, which is great. States are the laboratory of democracy. So if there's examples that we can point to, our population's unique. We know that, but I think those are all strategies to help. But it's critically important. I mean, it's a great question to try to solve.
Yeah, and it's a long term, right? So some of the best ways to make arguments for funding is to have data, and have data that shows that there's a need, that there's an outcome that was achieved. I think the other thing that's really challenging is there is often this conversation of what is this investment going to do? How is it going to save money? And we try to sometimes think about, as opposed to framing it that way, or to think about cost savings, because cost savings is incredibly hard to score. Being a public health preventive medicine physician, we talk about vaccines, and it's really hard to score what is that cost savings. But we can demonstrate what are the outcomes that are improving, who have we touched, how have their lives improved, and sometimes really focusing on that piece is what helps get us through. So telling those stories, keeping the stories coming about how our programs are making a difference for the people we serve is incredibly important.
Fantastic. Thank you all so much for taking the time. You were truly inspirational. Please join me where you're at in thanking them. And John, I'll send it back to you.
Thank you all. Thank you very, very much. And a couple things that I'm gleaning from our discussion over there is building on the standing on the shoulders of giants is my experience in the last couple of years coming on board and having those leaders that you just heard from really helping shape this future of data, even including the positioning and role and responsibility of CDII and how we can make a difference in terms of supporting all of you. Really excited that we're close to 900 attendees. So we're close to that 1,000-person mark that I promised the secretary we'd try our hardest, so maybe call a friend and say, hey, jump on, let's hit that number. That'd be great. So I know we had one of our department spotlights. We're getting ready for a second one. So we're going to share our second department spotlight, which is from the Department of Managed Healthcare. So listen in as we discover how the Department of Managed Healthcare Help Center Data Analytics section works to assist consumers with healthcare decisions. Here we go.
The 2023 Data Expo is proud to present the Department Spotlight. Our next spotlight is focused on the Department of Managed Healthcare, or DMHC, whose mission is to protect consumers' healthcare rights and ensure a stable healthcare delivery system. DMHC provides direct assistance to consumers and providers through the DMHC Help Center. The Help Center's data analytics section analyzes consumer complaint data to identify trends and challenges consumers face when trying to understand their individual healthcare coverage. In addition to identifying these trends and challenges, this team also analyzes provider complaint data, and they incorporate enrollment data from DHMC's financial office to identify irregular trends and help ensure health plan compliance with all applicable laws. DMHC Data Analytics section also assesses challenges that providers may experience in receiving timely and accurate claims reimbursement funds. The data-driven discussions and initiatives at DMHC has resulted in multiple positive impacts, including updated utilization management guidelines, correcting inaccurate data submissions, and improving consumer access. Ultimately, these efforts ensure a stable healthcare delivery system and protects the healthcare rights of the 29.7 million Californians enrolled in health plans regulated by the DMHC. We'd like to say a big thank you to the Department of Managed Healthcare for all of the great work that you do.
All right, everyone take a breath. we definitely have navigated some rich and complex subjects. So let's take a moment and pause and reflect, and we're going to take the first break of the day.
That's right. So we're going to reconvene here in 5 minutes. Sure you're back here on time because we're going to start on time, and we have a lot more exciting discussions waiting for you.
There we go. Break. Welcome back. While everyone gets settled back into their seats, we have a question for you. We want to know, how would you rate your level of data literacy right now? 1 being no clue, 5 being you're an expert. Go for it. Pull up the Slido. If you haven't been here with us, just go ahead and scan that QR code and answer our question for us. Let's see how many people are jumping in.
People are already jumping in.
Got about 40 people out of our 900 and, are we at 900? Someone's going to tell me.
Yeah.
You can tell that I'm really fixated on
925.
that.
Oh, there we go.
925, guys, 75 to go. This
3
this
and
next
4.
panel will definitely be worth you getting your phone and getting your friends.
Be
online.
honest. Be honest.
Don't miss it. I see this group. They are ready to inspire you.
I think there's more 2s than there are showing up. Don't be embarrassed.
All right.
Looking good. 3? That's right. That's good. Right in the middle.
We have
there.
work to do.
Yeah.
All right.
We've
got
done
something
work
coming
and
up?
work to do. I
Excellent.
like that. Awesome. Thank you all for putting those responses in. We appreciate you engaging. Now we've got another department spotlight. Join us as we discover how the Department of Developmental Services uses data maturity and data equity frameworks to achieve equitable outcomes in data-driven initiatives. Here you go.
The 2023 Data Expo is proud to present the Department Spotlight for the California Department of Developmental Services. The Department of Developmental Services works hard to ensure Californians with developmental disabilities have the opportunities to make their own choices to lead independent and productive lives. How? By using data maturity and data equity frameworks to promote inclusivity and achieve equitable outcomes in data-driven initiatives by addressing systemic biases. The data maturity framework is a tool used to measure an organization or project's ability to gain value from its data. It covers collection, storage, processing, analysis, privacy, and other parts of the data lifecycle. The data equity framework is a model designed to ensure fairness, justice, and equity throughout the data lifecycle, from collection to decision-making. The Department of Developmental Services is involved in several transformative efforts to improve its capacity to collect, store, integrate, analyze, and extract meaningful insights from data. Major milestones in their data maturity journey have included establishment of standing cross-functional teams to improve data literacy and use, highly democratized data access and implementation of collaboration-boosting technologies like Git and data simulation. Ultimately, using these established models in their planning will increase transparency and help avoid blind spots and bias in their understanding of the experiences of people with developmental and intellectual disabilities. So thank you to the California Department of Developmental Services for all of the great work that you do.
It is great to see what DDS is working on and just extracting some meaningful insights from data here at CalHHS.
Yeah, really amazing. And it's actually a perfect transition as we move from policy applications of data to its equity impacts at CalHHS. Data is not just about vast trends and big numbers. It's about individuals, as we've talked about. It's about our ability to provide the right services at the right time and about meeting people where they are.
That's right. It's important to remember that our ultimate goal is not just to collect and analyze data, but to translate that analysis into real-world change. Our work affects the lives of real people, and every piece of data we collect and every policy we form has real-world impacts on our California communities.
Absolutely. Our next speaker has been spearheading our equity initiatives here at CalHHS. Please welcome our CalHHS Chief Equity Officer, Dan Torres.
Hey, Dan.
Good morning, and thank you for joining our next panel on equity and building a bridge for change. I'm really excited to introduce you to my colleagues who I have the pleasure of working with every day on equity. And this includes Christine Blake, who is with CDII and the product owner of the equity dashboard, which we'll get into in a little bit more detail. Dr. Rohan Radhakrishna, who is with CDPH. He's the Deputy Director and Chief Equity Officer for the department. And Marcela Ruiz, who is the Director of the Office of Equity at the Department of Social Services. And to begin with, I want to talk a little bit about what we've done so far with developing strategic priorities around equity and impact goals and metrics that are really driven by data. And we'll be getting into a little bit more detail about how that's all working, but Christine Blake's going to walk us through a little bit more about how we're tracking the data, how we're measuring progress, and how we're visualizing the work that we're doing and the work we have ahead. So I'm going to go ahead and pass this over to Christine to walk us through the equity dashboard, a fantastic tool we're developing.
Thank you so much, Dan. I appreciate the time and I appreciate being here. Hello, CalHHS. It has been a year since I've seen you, and we have made plenty of headway, and I'm glad to be here to share it with you. So if we go to the first slide, I just want to share a little bit about where we are with the Equity Data Dashboard. This is an agency effort, and we released our first version of the dashboard on July 13th of this year. And this is, like I said, just the first version. We are collecting demographic data sets such as race, ethnicity, sexual orientation, and gender identity. And the journey to get to version 1 has been very, very valuable for our team. I do want to give a shout out to our equity dashboard team, our data engineers, our comms. You guys have taught me so much this year, and thank you so much for all you've done. So with our equity dashboard, this is basically an interactive tool that allows you to see across different departments and programs how they are collecting demographic data and what populations are providing that data. And this is extremely important. And while that's version 1, as we move forward into the future, what we really want to do is we want to understand, as Dr. Scott was saying, different populations and how our programs are serving those populations. It's extremely to know that people are behind the data. And so we want to collect as much data as we can, but we also want those people to feel comfortable giving it to us as an agency. So we are excited about version 1. We are moving forward and working on version 2 currently. And I will say that a part of the most important part I would say about this process is the people. So we extended out interviews for our data experts, our equity experts, and had a conversation with them around the data that they collect and the people they serve. And that really put value on what we were doing in terms of this project. And so when we talked to them, we also asked them, what barriers are you facing when you're collecting these data, this data from the population? And one of the most, I would say, one of the most important pieces of information that we got back was that we didn't have California HHS data standards. And so we asked, well, how would we attack that? How would we kind of approach that? What's the opportunity there? And what we did is we created a data standards community. And if you go to the next slide, I'll talk about the different work streams that we came and realized we could identify out of those, out of that information. So, of course, you know, we are collecting the demographic data. And we also have created the data standards community. And what value this has brought to the agency has been incredible in terms of different departments actually sharing what data standards they used based off of federal requirements, state legislation, et cetera. And so those departments have been sharing that across our agency in those settings. We've also been able to work with the Office of Data Innovation in terms of their executive order to provide data standard recommendations, excuse me. And we're moving forward in that direction in terms of identifying what those data standards are for the actual agency. Thank you, Dan. So one of the other important items on in our work stream was accessibility. And accessibility was extremely important because having a data dashboard, we want everybody to be able to use it. So we went through Department of Rehab to work with people to identify if we could go through screen readers, et cetera, to make sure that this dashboard was accessible. In addition to these work streams, we've also worked with our agency leadership in terms of our impact goals and equity metrics. So let's go to the next slide. So for our strategic priorities and impact goals, these were a result of our agency's decision to make our strategic priorities more equitable. What they also did is put action into those items And when I say making them actionable, we created impact goals and equity metrics as an agency. We were also asked to put those within our dashboard. So you'll see an example on the screen of those impact goals and strategic priorities that we'll be measuring until 2024. And if you go to the next slide. This is another example of one of those the impact goals and equity metrics that we are currently placing in our dashboard. And we're super excited to host this into the equity dashboard.
Thank you so much, Christine. And that's just a glimpse of what this is going to look like as we build out the equity dashboard. This is an initial minimal viable product, right, that will continue to evolve. We've got at agency several work streams where we are identifying other impact goals and metrics, and we'll eventually put them all on the dashboard and make that available to our leaders at the agency and departments. Now I want to turn your attention to Rohan at the Department of Public Health. And Rohan, what are the ways that your department is using data to tell the story of equity in your field?
Thanks, Dan, and such a pleasure to be with all of you. My name is Rohan. I stand for love, dignity, and transformation, and it's an honor to be with these panelists as well as all of you, hundreds from our agency today. The title for this panel is Building a Bridge for Equity for Change. And when I think of building a bridge, there's a few key ingredients, Dan. There's the blueprint, there's the builders, and there's the bricks. We're really good at the bricks as data people and health and science people, but I want to spend a little time talking about the blueprint and the builders, the people behind the work. Workforce development is such a key part of what we do. Health is really in the growth moment, as the secretary highlighted, 60% growth in our budget. So when I think about the blueprint for guiding this work within our department and more broadly, I think about two mantras that we're really grappling with. The first one is no data without story, and no story without data. Both and are really required for transformational change. And that's really part of the theme of the Expo today. The second one is no data without equity, and no equity without data. So I'm going to talk about both of those a little. When it comes to no data without story and no story without data, we have so much data. Dr. Scott talked about how we're almost drowning in data, but starved for storytelling, and it's that human aspect that really brings the work to the next level. And narrative and communications is so important in what we're trying to achieve. You know, the secretary said that a data point is really a character in a story or in a plot. And we are continually asking ourselves, do we have all the characters? Are they representative of the diversity of California? Are there people or populations or insights that are missing or that are suppressed? And what is our role in shining a light on and liberating some of those data? So that's something that we're constantly thinking about. When it comes to that second mantra question of no data without equity and no equity without data, we need to go a little bit further in acknowledging that really making data transparent to the public is what drives accountability and what drives trust in government systems, which is so important because the data is only as good as the quality and the representativeness of what we get. That's challenging our teams to go beyond receiving and analyzing data, which is necessary, but it's not sufficient. One question we have to answer is, how are we inspiring trust in communities to share complete data so it shows up on our dashboards? And those are tough questions. And in a time of mistrust and historic government harm, getting representative information on race, ethnicity, sexual orientation, gender identity, immigration, language, functional status, disability, place, at a time of surveillance and concerns around artificial intelligence, trust is low in government. So these are tough questions that we are struggling to answer to really weave together the combined synergistic power of equity and data together. So that's another aspect of kind of the blueprint that we're trying to guide the work that we do at Public Health, with a lot of innovations and also tough lessons learned during COVID, but also a lot of work that we're proud of, being in the spotlight in the past few years and wanting to bake in some of those lessons learned. I'll end by talking about the builders, which are the people behind the work. And much like we're so excited to be featuring our moderator, Dan, our first ever agency chief equity officer, and we have 17 equity officers across the departments and offices in our agency, we're trying to build that similar workforce and community of practice at the local level, to have those equity builders across California, from urban to rural, to coastal, to inland. And data is a field that's been around for decades, but equity is newer. At every local health jurisdiction, we have whole teams of data and epidemiologists and data scientists, but we don't necessarily have equity leads. So that is now an agency and a Department of Public Health priority, and it will be tracked on the dashboard that Christine just shared with you. We're proud that as of now, we have more than 45 out of 61 local equity leads, because it takes that rigor and focus and sophistication to connect with story, to connect with data, and to partner with those local data leads. Equity deserves the same bandwidth of a workforce, and we're proud to be growing that workforce. In fact, in September of 2023, we'll have our first ever statewide convening of equity leads at the local level, and we'll be training them in storytelling, in communications, in messaging, because it's so important to data and so important to equity. So I'll end by sharing that as we try and implement some aspects of these blueprints and these tough questions that we're constantly answering and try and support the builders, it includes our existing workforce. We saw in the poll we just all took that we have a lot of strength in our data literacy, and yet there's still areas to grow in. I'm proud that our director, Tomas Aragon, has offered free training to all staff in some of the basics: causal inference, small population methodology, which is really important for our tribal and other subracial and ethnic groups. And going back to basics for our growing workforce is really important so they can deliver for the diversity of California. So I'll end with this final quote that I really like sharing, which is that if we're not intentionally equitable, we could be unintentionally inequitable. And I think with artificial intelligence, it may be a theme for future conversations, we really need to up our game and grow our teams, and that's what we're trying to do at the local and at the state level. Thanks.
Thank you, Rohan. So much rich detail there that we could definitely develop into a future conference. So stay tuned for that. I'll pass this over to Marcella. Marcella, can you tell us the story of CDSS? How is CDSS driving change through data and in its equity work?
First of all, let me say how inspired I feel by being part of this panel. Christine, thank you for sharing all the incredible work that agency is leading, and Rohan, always so inspirational in your comments. Absolutely, data is a vital tool in our equity work. And so I just also wanted to take a moment to thank all of our data professionals out in CalHHS. Thank you, because you really provide us with the vital tool in order to advance our equity goals. It was shared on an earlier panel that the data itself is not going to define our equity goals, but it's critical information, right? As we map out our path forward and we determine where we want to go, where we're headed, what our equity goal is, it's the data that tells us where we're starting. It's the data that provides guideposts along the way to inform us on how well we're doing and actually achieving our goal and reaching our destination. And so for us, across the board, across the different programs that CDSS administers, from child welfare, adult services for older adults, immigration services, and the public safety net, the data that we have on our programs, the data of who's participating, what outcomes for those individuals is critical, again, to achieving our equity goals. I did want to take a moment to lift up what I have seen as, or we have seen as, some of the consistent challenges that come up in this space in our equity work around the data. And Rohan alluded to some of those and spoke about some of those issues. But one of those issues is the sufficiency of the data or the accuracy of the data. For some of the same issue that Rohan and Christine alluded to, sometimes we don't collect it, or we don't have the trust from community in order for them to share their data. or we're not asking the right questions, or we struggle with the approach on how to ask the right questions. We see that and the level of disaggregation we have for a number of communities, or how we collect information, say about tribal affiliation or Native Americans. For the Asian American Pacific Islander community, we know we've struggled with disaggregating that data or collecting that data in a way that really informs our understanding of the outcomes for the specific communities within the API population. Or we struggle with collecting data on the LGBTQIA population, right? There's sometimes a discomfort in asking certain questions, and a really good debate about when and how questions should be asked about sexual orientation or gender identity. So overall, there is a broad question, a broad dialogue about the sufficiency of the data. Also, because in the equity space, we are often working with populations that have been excluded, sometimes by design, through our policies, current policies, older policies. We don't always have the expertise in-house around specific population. I'll lift up a very specific example from our department. We were recently working with our Chief Equity Officer, with Dan Torres, on standing up a program, disaster assistance for immigrants. Immigrants by design are excluded from some disaster recovery services, and the data sets that we have available through the ACS, through the census data, it's very inaccurate for a number of reasons. One, because people might be nervous to come forward and disclose their information because they don't trust that the government won't take negative action against them when they disclose the information. Two, we know we have a difficulty in collecting information from people who are low income or live in rural communities. So there are a number of compounding factors that really weigh on our ability to have access to that data, and we don't then have internal expertise on working with the data sets related to those populations. And so it's really important for us to think about who we can partner with externally that can enhance our capabilities internally to work with those populations. And the other challenge, which was also lifted up by a prior panel, is sometimes the complexity of the data makes it really hard for critical community partners to be able to participate with us in conversation about our equity goals and our equity strategies. And I think here we have to account for our obligation, right, to present the data in a way that is accessible, that people can read, that people can understand, so that they can participate with us in those conversations. In our equity work, community engagement, community partnership, handing over the tools to the people most impacted by the decisions of government is a critical principle. And so that means presenting the data in a way that is that others can understand. So broadly speaking, I would say that we have thought about our approach to the data, how we build that internal capacity, and then how we build tools to invite community to participate with us in the equity conversations.
Thank you, Marcella. It's also a very rich and detailed summary of your work. I want to go along with that theme and ask another related question about how we utilize data to understand the equity needs of our communities and the solutions ahead. I just want to name that a lot of our data conversation is about the quantitative data that we're trying to gather, or what's available through other research. But we should also think about qualitative data and ways that we can collect information from our communities about what's happening in the community. Oftentimes, the quantitative data tells us a description of what's happening, but it doesn't tell you why it's happening, or what might be the solutions that are available from the perspective of community. So I want to pose a question to all of you. How do you see the use of qualitative data informing the equity work that we're doing at agency and departments and offices? Any volunteers first?
Yeah, wow, I love that question. I'm excited to hear from everyone. What struck me about your description, Dan, was how you also started with the word solutions, right? CDAI isn't just about insights, it's the other eye is about innovations towards solutions. All this work has to be about closing equity gaps. So are we asking the right questions to generate the right data, whether quantitative or qualitative, to set us up for the policy solutions that are needed? So love to share a few thoughts on it. One thing we're challenging our teams to try and learn and engage with is this concept that we recently learned from UC Riverside. They have a Center for Social Innovation, and they've done great work around this concept of DNA, which stands for data, narrative, and action. And when you said solutions, it really made me think of that because, again, data without the narrative is incomplete and not as powerful as it could be, and narrative without the data isn't fully complete and as powerful as it could be, and both are needed to drive action or solutions. And sometimes we can get siloed, not only across our 17 departments or offices, but even within our departments and offices and our teams. Oh, you're the data person, you're the communications person, you're the policy person. How can we learn each other's trades enough that we can bring together the collective power of all three? And so I'm really challenging our teams to include that in everything we produce. If it's a talking point in the same sentence, we should have data, some qualitative as well as quantitative, to tell the narrative, to drive us towards an action. If we're creating an infographic, a two-pager, it should also have narrative and action, a proposed policy solution with the best of the literature that we have to support it. And if we're writing a 100-page brief, which a lot of my teams do, we're required statutorily to produce these reports, that we go next level and add aspects of narrative and action, which can be uncomfortable sometimes for people that are deep data experts, but we want them to be part of more collaborative teams that start to bring in more of the qualitative. So I think the qualitative helps us. It's that, are you asking the 10 questions before you get the one right question that you may get the quantitative for? That's one thing I learned back in graduate school. And I think it gets us both towards the why, but also towards the solution.
Thank you, Ron. Marcella or Christine?
I'll add, and I love that and love the concept of DNA. So thank you for sharing that, Rohan. To add from a couple of examples, I think that come to mind from our work at CDSS, again, to build on what I talked about earlier in terms of the populations where we don't have sound data. The qualitative data becomes, or sound data sets, the qualitative data becomes really important, right? So the interviews, the testimonials that we receive from farm worker communities or immigrant communities or tribes, Native American population become that much more important. Not to say that that qualitative data is not critical when we have other forms of data. And here I'll draw on an example from our workforce equity goals internally at the department. Over the last two years, we have made a really focused effort to share department-wide our demographics in the department. It's important for us to compare the demographics of our workforce with the demographics of the state, with our program population, to understand how representative are we. We know that diversity in a workforce brings a strength in decision making, and so we really want to lean into that diversity goal for our workforce. If you look at the numbers, you might think that some populations may be overrepresented or underrepresented, but it's not telling you the full story of the experience of our workforce, right? So the level of representation is just one element in terms of how people, how represented a particular demographic is. The other question is, and then how do they show up? What are the conditions that we have created? What is the culture we have created that allows them to bring their ideas forward and participate in the decision making in the way that we want them, for that strength that comes from diversity? And here is where the qualitative data, the information that our workforce give us through many different means, right, through many different channels, is really critical. So in addition to the disaggregating or or sharing rather a workforce demographic dashboard with the team. We have conducted some surveys, and we have other avenues for our workforce to express to us what their concerns are, and that qualitative data needs to be presented side by side with the quantitative data that we have in order to ensure that we are actually meeting our workforce equity goals.
Thank you, Marcella. Christine, do you want to weigh in?
Yeah, and this has always been an interesting topic for me, because when I started with data, I really wanted to understand what the actual meaning of qualitative data was. And I learned it really quickly when someone simply asked me, "What's your story?" And I think that was so powerful, because it allows you to actually have to dig in and find out, what is your story? And I think in the simplest of forms, this agency, the reason why I love working for this agency is because we are interested in your story. We're interested in the people that we serve. What is your story? Where are your barriers in order to get the services that we're providing? What are the gaps that you're experiencing? And I've heard so many of these stories, and they've literally changed my life. So you have a person who may have an older father who is a veteran, who has not signed up for Medicaid or Medi-Cal and needs to go through that process. Where do you start? And then when you hear those stories and you're not able to get your father into a care facility because you don't know the policies and procedures of Department of Aging and DHCS and so on and so forth, but then you start to see the whole person, right? In terms of the different services that we provide from different departments and programs. And so qualitative data is important because it allows us to understand what the individual's story is, not what program we're focused on, but what their story is and how many services we can provide to them and give them that whole person care. So I think that's the reason why qualitative data is so important. And then the actual quantitative data backs that up and gives you facts, and that's what turns data into policy, if that makes sense.
It totally makes sense. Thank you for that. That's a very, very powerful way of putting it. It's so true. When I think about data presentations and I walk and I hear a story behind it, I don't necessarily remember the numbers. It's the story that the person presented about how their life was impacted or what's changed that resonates for a long time after that presentation. And the data may change, but that person's narrative will carry on. And that's the piece I feel like really needs to be combined with the work we're doing here. So I really appreciate that. Another topic that you raised, Rohan, I want to get back to is how we can't do this in a siloed way. And so I want to hear more about the collaboration that's taken place across departments, offices, the agency, counties on data collection and driving equity, advancing equity with partners. How are you all doing that? Can you share a little bit more?
Yeah. And before I do, I just want to briefly build on both these amazing ladies' comments.
Please.
Public health has learned so much from social services, and we just launched an all-staff racial equity and healing survey. And we knew psychological safety is key to trust, to workforce, but we didn't just ask on a Likert scale between 1 and 10, how psychologically safe do you feel in your team or in your department? It was the qualitative that gave us the richness, that knew what solutions and interventions did we actually need. And then what Christine shared really resonated because, before we hopped on stage here, John Ohanian handed us these little tokens, and it has the 3 slogans of data-driven, equity-focused, and person-centered. And I think it's really the qualitative in the story that is the person-centered aspect. That's what sticks when we're testifying to the legislator, when we're interacting with communities. And so it's so important to elevate the qualitative. I think the collaboration is really our challenge ahead. We have these emerging communities of practice. We're getting more cross-sector. We're building them at so many levels where state is supporting local and counties. State is working within their own agency and even with other agencies where there is overlap for certain topics. I think environmental health and climate change is a great example where there's a lot of cross-sector overlap. We learn deeply about certain populations, certain methodologies that are needed for new challenges. So I absolutely think we need new partners as part of our ongoing collaboration work, and it's up to us as leadership to create those spaces and opportunities for us to collectively have our workforce learn from and support each other.
Excellent. I'm hearing that we have some questions coming in, so I'm going to go ahead and transition to the questions. Let's see. First question is about the importance of robust, secure information technology, and how that can be a vital partner to data collection. And then when it comes to demographic data collection, are we working to collect the same type of data across all agencies and offices to align statewide? So it's, let's go with the question about data standardization. There's a lot of work happening there. So maybe, Christine, can you weigh in on that?
Yeah, so in our community, and let me just make sure I understand what they're asking. The working of the
When it comes to demographic data collection, are we working to collect the same type of data across all agencies and offices to align?
That's an amazing question. So we've learned so much when it comes to data standards and what programs are doing. There are so many different federal legislation, federal requirements, state legislation, reporting requirements that different programs within different departments have. So when it comes to the data standards, even when they're collecting that information, it's not the same across the board. But if you look at the Office of Management and Budget, who is our federal partner in terms of data standards, they haven't even updated their data standards since 1997, and they're starting to look at that today. So of course, as an agency, us being our forerunners, of course, we have partnered with, like I said, the Office of Data Innovation, who's actually forming data standards at a state level and providing recommendations as to how we would move forward as a state. Now, in terms of our agency, we would like to kind of be in key step in making sure that we have data standards as an agency, but we also want to make sure that it addresses our population that we serve. So, and Rohan's educated me on this in terms of specifically like Nicaraguans, right? There's over 100,000, and because we're situated in the state that we are, there's a lot of demographics that come to California that the federal level may not be including. So we have to look at the population of California to really understand where we go with standardizing what data we collect and what data we report. Hope that answers your question.
Yeah, do you, Marcella or Rohan, want to weigh in on data standardization?
I think just to take the moment to really thank Christine for her leadership on the data standardization. I know that it's an effort that we have begun to undertake at CDSS as well, but I think maybe tying it back to your prior question, Dan, around the collaboration with an agency, I think it is supremely critical, right, that we have data standardization approach across our agency so that we are able to compare our data sets, use our data sets interchangeably, and unless we're using similar definitions, we're not going to get there. So I think this is one of the most critical endeavors that we have in the equity space at the moment.
Yeah, I would just add on the collaboration front, thinking a little more about the external collaborators. So I think community groups and academic partners think deeply about this. When the Federal Office of Management and Budget's invited public comment, they got more than 15,000, and they were amazing detailed responses on different populations that people can forget about. So it's up to us to standardize across, but we also have to have the humility to listen to other partners that may know their communities better than we do, so we get the right fields and sub-descriptions on our dashboards.
Excellent. Well, with that, we will close out this panel. I want to thank my panelists, Marcella, Rohan, and Christine. As you can see, I'm a lucky person to get to work with these really smart people. And thank you all for joining us and listening to this panel. We'll close it out. Thank you.
Thank you.
Thank you to our panel, and absolutely, equity in data is certainly important here at CalHHS. And just thank you to our panel. And last year our focus was on equity, and we continue to drive that through. And I think one of the important parts that I'm learning from that panel about storytelling is when you're on the other side, it's the listening. And not only just listening to the story, but maybe active listening a little bit and unpeeling what someone's sharing. So just really, really great panel. Thank you, guys.
Yeah, absolutely. I mean, every time I listen to this group talk, I come away a better person, like genuinely. So thank you all. And now we want to hear from you again. It's time for another audience poll. Right now, I know a lot of us are dealing with the end of summer, stress, knowing that projects are due, stress or relief, knowing the kids are going back to school. Next break, we're going to have a wellness activity that I think you're going to love. that'll help with some de-stress and relaxation. But before we go to that, we want to know, what is something that you're grateful for? So you should have the Slido screen up again. Get back on your phones, and we would love to hear what you're grateful for.
Life and family.
Absolutely, love that. My wife, my dogs, health, downtime, that's a great one. Cooler weather today, absolutely.
I see Job up there.
Excellent, I like to hear that. A couple of those. My partner, having dinner every day.
I saw a co-host. That's kind of cool.
Is that you or is that me?
Oh, I hope you wrote about me.
My pandas and my family, I know who wrote that one.
Oh, yeah. And by the way, I got some good news during our segment that we had about 900, and I think the number was 930, but we have over 100 in watching rooms, so we can tell the secretary we had 1,000 this year, so that's some nice news.
Fantastic,
there. I'm
that's
going to tell
great.
them first. So thanks for calling a friend and joining us here at the Expo.
Yeah, thank you.
So really appreciate you engaging. We asked last year, did you like that kind of an engagement? So please let us know, give us feedback. Maybe there's questions you'd like asked at next year's Expo, so please give us your feedback there. It's now time to share our next department spotlight. We have the Department of Youth and Community Restoration. Take a peek how OYCR is working on reducing low-threat arrest incarceration rates for girls and gender-expansive youth in California. Here we go.
The 2023 Data Expo is proud to present the Department Spotlight. This spotlight is focused on the Office of Youth and Community Restoration, which supports the transition of justice-involved youth being served in local communities and promotes a youth continuum of services. OYCR teamed up with the Verrett Institute of Justice to create the Ending Girls Incarceration in California Action Network to reduce and ultimately eliminate the incarceration of girls and gender-expansive youth in the state of California. Of the more than 1,400 detention admissions made in 2021, nearly half of those admissions were for low-level charges that typically pose no serious threat to community safety. The partnership will begin with 4 California counties and provide them with technical and funding resources to examine their local data and identify system and programming gaps so that they can implement equitable policies and gender-responsive programs for girls and gender-expansive youth. At the conclusion of the Action Network, these counties will be eligible for additional funding from OYCR to support ongoing coordination and implementation of local efforts to end girls and gender-expansive youth incarceration. Ultimately, the Action Network aims to reach a zero incarceration rate for those low-level charges committed by girls and gender-expansive youth by 2027. This incredible initiative was launched in March 2023, so does not have any results of the statewide work at this time. However, OYCR anticipates similar reductions of the incarceration of girls and gender-expansive youth as have been realized in other jurisdictions like Santa Clara County. So a big thank you to the California Office of Youth and Community Restoration for all of the great work that you do.
Fantastic, such great work that they've been doing there. It's great to see. And I know it's hard to believe, but it's been another hour already.
Well, one more to go. I guess that's me.
That's you.
All right, let's do it. So we're going to take a break, but don't go anywhere this time. We're going to take a break together. We're really happy and honored to have Dr. Soba here, who's going to lead us in some incredible wellness, relaxation exercises that our team experienced and wanted to share it with all of you to help you feel more relaxed and centered. Dr. Soba.
Yes.
I'm Dr. Soba Sundarajan, trained in internal medicine, kidney diseases. And after COVID, I started teaching yoga and meditation. And please welcome to join me in these yoga stretches and heartfulness relaxation. Take a comfortable seat in the chair. Sit in front of the chair. Keep your feet 6 feet distance apart or hip distance apart. Keep the knees on the top of your ankles, relaxing your thighs, relaxing your shoulders. Soften your spine and lengthen it. Keep your hands wherever it is comfortable for you. Relaxing your neck, relax your jaw. Softening your face, gently close your eyes. Breathe in and out through the nose. Bring your awareness to your breath. Feel the cool air going in, warm air coming out. Gently scan your body, scan your mind, connect your breath to your body and mind, and be mindful throughout this session. Let all the negative thoughts, negative emotions leave the room. Now breathing in all this fresh energy, fill up completely your body, and breathing out, release the tension and relax the entire body. Breathing in what is good for you, what is needed for you, and what is positive, and breathing out what is good for others. Breathing in positivity and breathing out optimism. Breathe in understanding and breathe out compassion. Breathe in sensitivity and breathe out love. Breathe in love and breathe out love. Centering yourself, take few more breaths in and out. And gently start energizing your heart center, center for peace, love, compassion, creativity, and consciousness. Breathe in through the heart and breathe out through the heart. And slowly invite that divine energy from the universe through the crown of the head to your entire body all the way to the toes, nourishing each and every cell in your body. Take a breath. Bring your hands to your eyes. Gently open your eyes if you're closed. Breathe in, bring your hands out and up. And breathe out, bring them back to the center at the heart level. 2 more. Breathing in, lifting up, and breathing out, centering yourself. 1 more. Breathing in and breathing out. Relax your hands down. Side stretch. Breathing in, lift your right hand up, hold it to the left, lengthen your side body and breathe. Feel the rib cage expanding and breathe into it. Breathe in, lift. Breathe out, release your right hand down. Left side, breathing in, lift your left hand up, hold to the right, and feel the left side. And slowly lifting up, release your hand down to the thigh. Take a breath. Now twisting your spine, bring your left hand to the right thigh, right hand to the back of the chair. Lengthen your spine, twist to the right side, look over the right shoulder, and breathe in and out. Feel the twist from the waist, the chest, head and neck follows. Relax your face. Have a smile on your face and breathe. Breathe in, come back to the center, release your hands. Right hand goes to the left thigh, left hand to the back. Lengthening your spine, gently twist to the left, look over your left shoulder and breathe. And slowly come back to the center. And thank you all for joining me in this session.
I hope you enjoyed that as much as we did here. Need a hand?
Yeah. That was a great session.
That was a really good session.
And now it's time for a department spotlight. Let's watch and learn how the Office of Surgeon General is addressing adverse childhood experiences, or ACEs, and helping treat the impacts of toxic stress in children.
The 2023 Data Expo is proud to present the Department Spotlight. Today, we would like to introduce you to the California Office of the Surgeon General. The Office of the Surgeon General began the ACEs Aware initiative in 2019. This is an initiative to screen children and adults for adverse childhood experiences and treat the impacts of toxic stress.
The main reason I'm a pediatrician is because I like prevention. My job as a pediatrician is to make sure that kids stay healthy and grow into healthy adults. In our office, we are now regularly screening our children for ACEs. ACEs stands for Adverse Childhood Experiences. My ACEs training, even though I was seeing lots of kids who had ACEs scores of 0, really helped because I was able to teach all of these kids ways to calm themselves down, to reduce the stress, and to be able to get back to life. I do believe that ACEs screening will become standard of care very soon throughout the country. And I'm proud to be part of a team that can identify these kids on a daily basis in our office, intervene early, and really benefit society and our whole community.
The goal of the ACEs Aware initiative is to reduce ACEs and toxic stress by half in one generation. Since its launch in December 2019, the ACEs Aware program has seen more than 29,000 individuals complete the core ACEs Aware training, and more than 1.5 million screenings have been conducted by ACEs Aware Medi-Cal clinicians. So thank you to the California Office of the Surgeon General for all the great work that you do.
What a great way to wrap up our department spotlights this year. What did you think? Please let us know in the chat. What did you like to see? Are there other programs you'd like to see highlighted next year? Please let us know. You know, we had a great discussion about equity, and we've seen data's critical role in shaping our internal policies and promoting a fairer, more inclusive work environment. The value of data extends far beyond our internal operations, though. As we explore new approaches to data sharing, we're essentially extending our influence and potentially augmenting the impact of our work. We're building connections and collaborations that lead to wide-ranging benefits.
Absolutely, John.
Yeah.
Just as we've used data to inform our equity initiatives, sharing our data both internally at CalHHS and with other government organizations can help everyone with policymaking, strategic planning, and decision making.
So let's move on to a topic that's increasingly vital in today's interconnected world, data sharing. We have invited a panel of specialists who've been at the forefront of our data sharing endeavors to talk to us and let's try this again. We've been invited by a panel of specialists who have been at the forefront of our data sharing endeavors to talk to us through the processes, pitfalls, and potential of data in the rapidly evolving data-centric world we are living in.
Relax now.
Yes. I'm going to go meditate a little more.
Before we jump to that panel, we've got to familiarize everyone with the different types of data sharing agreements that we have here at CalHHS, because there are a few different ways that we go about that. And so we've got one more quick video for you that kind of explains two of the most discussed agreements.
Here we go.
Hello and welcome to the 2023 Data Expo. This video is going to explain the two data sharing agreements that are commonly used at CalHHS. We realize that there are many types of data sharing agreements, but for today's purposes, we wanted to review the two common types of data sharing agreements that are used at our agency. The Interagency Data Exchange Agreement and its accompanying business use case proposal is the first type of data sharing agreement, and the CalHHS Data Exchange Framework Data Sharing Agreement is the second type. Even though the Interagency Data Exchange Agreement and the business use case proposal sounds like these are two separate agreements, they're actually each one half of the whole agreement. The Interagency Data Exchange Agreement, or IDEA, is like the foundational piece. The IDEA basically establishes the legal framework of the data sharing agreement. The IDEA is what the state of California departments and offices use to share data with one another.
The idea also has a second part, the Business Use Case Proposal, or BUCP, which outlines the details of each sharing agreement. The BUC component helps establish the specifics for California state departments who wish to share data. It will address things like purpose, use, and security protocols for data sharing. So the idea establishes the standard legal terms for data sharing, and the BUCP outlines the specifics and details. Both are essential to making a final data sharing agreement. Our next data sharing agreement type is the CalHHS Data Exchange Framework Data Sharing Agreement, or DSA. State law requires certain entities, such as hospitals, to sign on to the DSA. An important clarification for everyone to know is that the Data Exchange Framework is not a technology or a data sharing repository. It's simply an agreement between Health and Human Services systems and their providers to share information in an appropriate and secure way. The Data Exchange Framework contains a single data sharing agreement that provides the details and rules to require the exchange of health and social services information between healthcare entities, public health authorities, social services organizations, and government entities in California. This single data sharing agreement is for participants who are either mandated or choose to share health and social services information. The ultimate goal of the Data Exchange Framework is to achieve better care, health, and well-being for Californians through the sharing of information between health and social services organizations by seeing a person and their needs holistically. And that's it, a high-level overview of the two common types of data sharing agreements here at CalHHS. More information can be found on the CalHHS website. So now you know. You're now ready to engage in our next panel discussion regarding data sharing making a difference. So listen in to our experts as they share their thoughts and experiences with data sharing here at CalHHS.
Really excited to introduce this next panel. I know that the title's been called, but I call it Sharing is Caring. Please welcome and join me in welcoming our final group of panelists, colleagues, and friends as they discuss the intricacies of data sharing agreements. I'm going to hand it over to Adam.
Thanks, John. Sharing is caring indeed. We have a phenomenal panel here for you today. I'm excited about it. We've talked about this journey we've been on, talking about getting to yes, talking about the idea and the data sharing agreement that started with CalHHS, went statewide, the open data portal, but there's been so much more stuff going on. And we have two of the esteemed leaders who've been driving some of that work, and I'm excited to get into that and let you hear about it. So maybe we'll just move right in. I'll let you each introduce yourselves while you kind of answer the fundamental question of why is your organization doing the work that you're doing? What's the purpose behind that? And maybe a little bit for you as well. So I start with you, Ryan.
Sure, happy to kick things off. So my name is Ryan Gillette. I'm the Chief Data Officer and the Deputy Director with the Research, Automation, and Data Division at the Department of Social Services. I'm thrilled to be on a panel about data sharing. That's probably not something you hear from people every day, but my first job ever was actually doing data sharing all day. I had to call up people as part of a federal housing voucher study that I was working on and try to convince them, some random intern, to give them data on all of this sensitive information on these people that were their clients, and they were like, who are you, what are you doing? But this whole notion of getting to yes is very much the ethos to bring to this. But I don't want to talk about that. I actually want to share an experience I had a few years ago where I got to sit in on a community engagement team in Sonoma County that was working on figuring out how to better coordinate services between clients. So the way that this team worked was every week, caseworkers from the Human Services Department, the Healthcare Department, Workforce Development, Probation, Housing and Homelessness would all get together, sit around a table together, and discuss their shared clients. And the purpose of this was to try to figure out ways that they could better interact and provide a better client experience for their shared clients. And one of the things that happened in this meeting that I was at was someone from the housing and homelessness team came up and said, hey, I have this client. They actually just recently made it to the top of the Section 8 housing voucher lists. And for those of you who don't know, Section 8 housing vouchers provide long-term rent subsidy. It can be a life-changing resource for people. Unfortunately, they weren't able to locate this client, and these vouchers there's sort of a time limit during which you can offer them that service. And if they weren't able to get it to them, then there was the risk that that person would lose that voucher. They'd sort of end up back at the bottom of the line, and it could be years before they had the opportunity to receive that resource again. Fortunately, though, someone from the Human Services Department who was there had actually just recently had a touch point with that client and was able to provide some advice on where they might find them, some updated contact information, and shared that with the caseworker from the housing and homelessness team. And what I found out a couple weeks later was that as a result of that meeting, that caseworker was able to go out, find the client, connect them with that resource, and that person was now stably housed. So this to me is a perfect example of the amazing power of data sharing and why it's so important that we figure out how to do it well. A lot of our programs and our data are siloed, but the humans that we interact with aren't. And what we need to do is figure out how to share information in such a way that we can provide the best experience for clients and make sure that they're getting access to all the services that they need in order to be successful. Of course, that doesn't come without challenges. One of the things that we need to figure out how to balance is the tension between all of these cool benefits that we've talked about that we can get from data sharing against client privacy rights and also the inherent risk that can come with sharing potentially sensitive information. We have access to a lot of detailed, personally identifiable information that if there was an inadvertent disclosure could lead to financial, reputational, even physical harm for some of these vulnerable individuals. The good news, though, is that I think we are now at a period where it is easier than ever to figure out how to balance these tensions. Thanks to a lot of the legal frameworks that we just saw in that video before, we now have a framework for how to think about how to ensure that we are protecting clients' rights and templates to work from that can expedite some of that legal contracting process to make sure that we have those agreements ready and in place. But then we also now have modern data infrastructure that can make sure that we are sharing only the most important pieces of information in a way that is secure and safe for the people who need to work with them. I mean, I remember back when I was doing my earlier data sharing work, when we needed to exchange data back in the day, you would have to get a thumb drive or a CD and encrypt it and walk it over to someone and hand it off, and then you always had to keep track of who has that data and are they going to destroy it at the end. And all these things are important. We definitely still need to do all of that. But thanks to the modern infrastructure that we have now, we can create secure data environments where maybe we don't even need to have the data leave our system at all, right? Maybe we can just provide people access into a secure environment where we can provide specific permissions for certain individuals to access just the data they need. Maybe we can even limit the variables that they get so that they only need to see the most important things that they need for the purposes of doing their analysis or their research. And one of the cooler things that I've seen that's really at the cutting edge now is thanks to fancier processing power and things like that, now we can even on the fly do encryption, hashing, masking of personally identifiable information such that if we did want to exchange information between two departments, we could do that in a way where we might never actually have to send a piece of sensitive information. So we can really reduce the risk associated with moving this information back and forth while also making sure that we are able to create those connections that allow us to provide better services. So I think we're at an extremely exciting moment, the precipice of a new era, golden era of data sharing in California. And I think we saw in Sonoma County that they're able to do it by just getting a bunch of people in the room together around a table. And I don't think there's any reason why we can't take that concept statewide and scale it to provide the best services that we can for people.
I love that. Awesome. And Marianne, a very different organization. Excited to you introduce yourself, but then to hear about your organization and the why you're doing what you do.
Sure, absolutely. So I'm Marianne Bates. I'm the executive director of the brand new Cradle to Career data system. I'm really grateful that you invited me here today. We're not within CalHHS, so we're actually at the Government Operations Agency, but working across lots of different entities at the state to bring together data from Cradle to Career. We were established recently, so we're brand new in legislation in 2021, so we're about 2 years into this. And the basic, at the heart, our mission is to advance equity for California's young people. And we do that by supporting evidence-based decision-making, by opening opportunity, by advancing equity with a focus on bringing information together that people can actually use for decision-making. Decision makers here at the state, but also families, students, and individuals across. So in a nutshell, what we're doing is building a linked data set from Cradle to Career, so bringing together education data, data on job outcomes, data on health and human services, and bringing that all together to help decision makers and students and families answer important questions that are hard to answer right now. So as Ryan mentioned, data is often siloed, and so it's really hard to see across a young person's trajectory, right, as they enter high school, or as they go on to higher education or training, and then getting a job and entering the workforce. Are they earning a living wage? What are the different pathways towards that? Are they receiving the services that they would benefit from? It's really hard to answer those questions when data is siloed in different institutions across the state. So what we're essentially doing is taking state-level data, so data that's already collected at the state level, already validated at the state level, and bringing it together and then making it available to people. And I can talk more about how we're doing that in a moment. I'm really excited about this work. Like Ryan, I get very excited about data sharing and linkages. I spent over a decade of my career working with government from the outside, so working at the federal level and with state and local leaders across the country. And so many times I saw innovative ideas to try to help kids or to open opportunity. I would see these innovative ideas just die the moment the conversation switched to the needs of sharing data. Because every single time it seemed we needed a new bespoke data sharing agreement, and then the lawyers start talking and a year passes and 2 years pass and more time and the window of opportunity closes. So a lot of what we're doing at Cradle to Career is to try to smooth that process by creating overarching legal agreements and an overarching approach where we bring the data together and then make it available in a way that makes it much simpler for state entities to share data with each other, and then for that to be made available to the public in ways that they can really use. And I think a really important part of that, I loved how Ryan told the story of real people sitting around a table and sharing information with each other. In the legislation that established our office, we're required to use a user-centered design approach to keep the person at the center, to really have that drive the work that we do. And I think stories are an incredibly important part of that. So as just one example, we have a 21-person governing board that I report to, and in their quarterly meetings, we often hear stories from people. And in the last meeting in May, we heard a story about a student who drove 3 hours in the hot summer sun to pick up his transcript from one place and bring it to the next place where he was enrolling in the fall. Because it was too hard. It was too hard to go through the processes that existed to transfer that information from one place to the next. And that story stuck with me. That story stuck with our board members. And it's informing and it's driving work that we're doing now with some of our partners to facilitate much smoother processes for just moving higher education transcripts back and forth as one starting point. So that's just one example of how we're trying to make sure that we're keeping people at the center of what we're doing and ensuring that we're really focused on and keep bringing information together that can help people answer questions they wouldn't otherwise be able to answer.
Thank you. So your organizations are very different, right, in structure and the way they were put together and the goals. Can you each maybe talk a little bit about how you use data sharing agreements, what the structures and tools are that you use to enable that work that you just talked about? And maybe just to mix things up, we'll go back to Marianne and work back this way.
Sure. So I'm happy to talk about our legal agreement, and we can display a slide that actually shows the logos of the 16 different entities that signed our participation agreement. And I should say, the video we just watched, the idea framework that we discussed in the video provided inspiration for the legal agreements that Cradle to Career signed with these 16 entities. And you can see CalHHS on it, as well as DHCS and DSS. These entities all signed one common legal agreement, the participation agreement. And what that does is it means that we can be flexible as we accept data. More data points can be added in the future without needing to re-sign the entire agreement. It's also not a stack of individual bilateral data sharing agreements that we have with 15 other entities. Everyone signed the same legal agreement, so there's transparency. Our data providers are on equal footing in how they share data with us. And so we hope that this will really facilitate more seamless data sharing both now and in the future. So where we're at in the timeline is that we're expecting to receive data from our partners for the first time this fall, and then we'll be able to start building tools and resources that we can share with the public. So for example, I can tell you a little bit about the tech stack behind what we're doing. We'll be bringing the data together in a cloud-based data warehouse, so using AWS and Snowflake for that. And then we'll link the data using a tool called Tamer, T-A-M-R. And that will enable us to bring data together with different kinds of identifying information from our different data partners, bring it all together and create one linked, de-identified data set that then becomes the foundation for sharing it with the public in 3 different ways. And we have a one-page cheat sheet on the work that we're doing that can be placed in the chat if you'd like to learn more. And our team would be happy to answer questions if you want to reach out later and learn more about how we're doing this work. But in short, we're going to do 3 things. We're going to have dashboards, a query builder, and a data request process. So for the dashboards, essentially each dashboard will tell a story or dive into a particular topic. So for example, we'll have a student pathways diagram that shows how people move from school, through high school, through higher education or training, and then into employment. And that will help people answer questions about which students are earning a living wage, what pathways to employment are really working for young people, how are they being served by our education institutions, how can we strengthen that? So that's one example. Another example is looking at our teacher pipeline. So teachers coming into schools, where are they being trained? What kinds of credentials and teacher training programs are resulting in teachers who are able to stay and thrive in the teaching profession? If they leave the teaching profession, where do they go? So we'll be looking at answering those kinds of questions with these dashboards. And then the dashboards will have an accompanying query builder, which is like a choose-your-own-adventure approach to being able to disaggregate the data and really zoom in into certain subpopulations of students, or being able to disaggregate by geography and be able to see what's the story across California or in my own community. So that's the query builder, which again will enable the public to play with the data. And we're thinking about privacy, so no cells will be able to display information if it doesn't have data for at least 30 people in it, so that we're protecting people's information. And then for researchers who are doing studies, we'll set up a common application, if you will, for the data points that Cradle to Career has brought together. So researchers can come to us and request specific data points through a common process. We can facilitate then getting that permission with our data providers and making the de-identified data available to them so that they can do the kinds of research and analysis that can really strengthen how California is serving young people in the state from Cradle to Career. So that's kind of start to finish what we're doing in a nutshell, but happy to hear more from Ryan.
I mean, it's so exciting, having been involved early on in the building of this, to see where it's come to, the work that you've been able to do in such a short amount of time since coming on. Probably doesn't feel like a short amount of time, but in the scheme of things, it's incredible. And I think back to Mike Valley on a previous panel talking about his ability with pre-prepped data to get a question 15 minutes before a meeting to be able to answer. And what you're doing is you're gonna give that power and that tool to everyone, to the world, right? To be able to do that across these data sets for the first time ever in California. I mean, it's truly amazing. Ryan?
Yeah, no, I mean, I obviously am very excited about this as well. You know, and I think what's especially cool about this project, Marianne, that you're working on is we get to benefit from it as well, not only from the data, but also from some of the processes that you've put in place. So I actually want to talk a little bit about a project that we're working on called the Early Childhood Integrated Data System, ECIDS. We're working on a better name, so if anyone out there has ideas, put them in the chat or email someone. But one of the things, I'll get in a little more detail about what that's about, but one of the things that's been great about it is, we will be able to leverage a lot of the agreements and the concepts that you all have established as part of this as we think about how we start to pull in data for our portion of that early childhood vision. But let's take a step back. So the ECIDS project is trying to solve a actually pretty similar challenge to what Marianne was describing, but just focused on the early childhood data landscape space. So right now, our early childhood data is scattered all over the place. So attendance data lives in a completely different place from subsidy data, which lives in a different place from our workforce data, which doesn't talk to our facilities data. And as a result, it's really hard to tell any sort of interesting sort of statewide picture about what's going on and what the challenges are and how we can do better. So the hope behind ECIDS is that we would be able to take all this disparate information and pull it together into a single environment where we can see how all of it interacts together, draw some more interesting analysis, interesting insights, and figure out who we're serving and who we're not serving as well. That last part, though, is a little bit of the kicker here. A challenge that we often face in most of our programs is that we really only have information about the people that show up at the front door. There's plenty of people that I'm sure could benefit from any number of the safety net resources that we have out there that, for whatever reason, don't access them. Maybe they don't know about them. Maybe there's not a location nearby. There's any number of reasons why that could be. But when we look at when we try to figure out how to answer that question, we're limited because we typically are relying on administrative data that is from the systems and the people that already are participating in programs. So one of the things that we're trying to do with this ECIDS project is see if we can, in addition to that administrative data that we have, fold in some of the publicly available census data and other resources that can tell us a little bit more about how to think about who we might be missing. So the concept here is, what if we looked at, take a particular geography, look at the historical census data. From that, we can say, we think there's this many kids in this geography, and then when we look at our administrative data, we know that, we have Y many kids, and can do the difference there and say, okay, there's some amount of them that we don't know about, right? Some of them, maybe they don't need our support, whatever. But if we start to then think about looking at different regions and saying, where is that delta the biggest? That might then lead us to ask some more questions about trying to understand if this is an issue that we want to try to address. So, imagine if what we were able to do was say, find a place where we think there's a particularly high gap of folks that could potentially be receiving our services but aren't. Maybe then, now that we have our facilities data integrated, we can map our facilities and say, it looks like in this area there's a population center, but there's not a childcare facility. Maybe that's a reason why we're not reaching folks. Or maybe we look a little bit deeper and we see that there actually are plenty of facilities, but all of the classrooms are full because we have that attendance data, right? That then tells us that's a different sort of thing that we might need to try to address. Or maybe the facilities have classrooms, but they're having trouble finding teachers to staff them. And then because we have the workforce data incorporated and other administrative data that we can pull in as well, maybe we can then learn a little bit more about who we need to focus on going out and try to recruit. Are there different languages that we need to focus on bringing in resources for? All those sorts of things. But the idea here is that by pulling all this data together, we can paint a much more comprehensive and interesting picture that can allow us to understand which policy levers we might want to pull in order to make sure that we're providing the best services for our youngest Californians. So I think this is a super exciting project. It's still very early stages, but it's, I think it goes hand in hand with the Cradle to Career tool, and we're really excited about how these things are going to partner so that we really can have that full Cradle to Career landscape.
Fantastic. Such great work. I'm a little bit early, but before I jump into the next question, let me pause and see if we have any questions from the audience. What kind of data systems are you using to customize sharing permissions features as described? Interest is piqued for all of us. Excellent. Thank you for that question. Either of you want to touch on that?
I'm happy to start. I mean, I'll say at the moment it's theoretical. It is definitely possible. The technology exists. So the big cloud providers have all sorts of tools that can do that, and the major, the Snowflake and the Databricks and the AWS and Microsoft, like they all have resources that can do some flavor of that. I think what we're trying to figure out is how to put together the right tech stack that will achieve the needs that we want, and that's one of the things that obviously we'd want to think about. The Agency Data Hub, I actually don't know if we talked about that in one of these other sessions, but that's a great example of a tool that will have some of that functionality as well. There's a secure data enclave as part of that has this notion of this permission-based system where people have to apply to get curated access. Once they're in it, they can do the analysis within that environment, and when they're done, we turn off the access and they're out, and we don't have to worry about any of those other, some Excel file living on a thumb drive somewhere that we need to take care of.
Absolutely. Yeah, Marianne?
Yeah, so just building on that, similarly, as I mentioned, we're using AWS and Snowflake, and everything is going to be cloud-based. So no thumb drives, no CDs that can grow legs in any direction. And that's the platform that we'll be using to receive data from our state-level data partners and bring it together. What hasn't been built yet, but will build in the future, is the secure data enclave to enable researchers to be able to access the underlying de-identified individual level data for studies. So we're still developing that. But privacy and security is at the forefront of that. One thing that I think is really nice about our governance structure, which is quite complex and extensive, is that each of our data providers, so remember that page of the logos you saw earlier, they can have a seat on our security policies task force. So as we're developing this data system, we're getting input from your colleagues, from your colleagues in all of the different education segments, and everyone who's sharing data with Cradle to Career to ensure that all of those permissions and access controls are as privacy and security protecting as possible. The other thing I forgot to mention may already be in the chat, but if not, we have a cheat sheet, if you will, of data elements by data provider. If you want to see what's coming into the Cradle to Career data system, you can see that in a PDF where it makes it clear with little X's and columns of which entities are sharing what. And there's just a few data points from CalHHS departments, but really excited to be in conversation with the team at ESIDS for the future as well.
I'm sure you'll have lots of people clicking in to take a look at that spreadsheet.
It's fascinating. If you're at all interested in data, you should it's just a great resource. I look at it all the time.
Absolutely. We've got a few minutes left, and one of the things we talked about that I think would be very interesting for folks was, for those of us who work in data, we hear things a lot. You can't do that because, or we can't have that piece because. And so do you want to touch on some of the myths that you've heard that you'd love with an audience of over 1,000 folks to dispel?
Absolutely. I think that just the biggest myth is a lot of times people just say you can't do data sharing, and I hope that over the course of the entire day and this panel we've dispelled some of that. I think there's a concept that I like that's called policy folklore, which is a lot of times someone will have one time had an experience where they tried to share data and they weren't able to for some reason. And they have now internalized that means they can't ever share data. And a lot of times what will happen is, maybe there was a real reason, right? Maybe there was some part of a particular statute and the specific thing they were trying to do, prohibited them from being able to do that sharing. But I would say 90% of the cases when someone says, this can't be done, and they point you to a statute, they didn't necessarily read the whole statute. And if you go back and look, a lot of times there will be the thing that says, this data can only be, or can't be shared for this purpose, and then there's a list of exceptions. And that's where I think we all need to collectively just, one, ask for, if someone says something can't be done, don't be shy about asking for where that is in the statute, or what's the regulation that says I can't do this. And then 2, once you get that, actually go read it. I think there's, in many of our regulations, there's actually some pretty sensible guidelines for the circumstances under which data sharing can be possible. And I think we have some really good legal teams that have been thoughtful about how to work within the confines of those to help us achieve our goals. So shout out to all the lawyers out there. We would not be here without all of you. So thank you, thank you. But yeah, this has been a long journey. The fact that we're on the 9th one of these and still talking about data sharing, I think is indicative of that a little bit. And I think we just need to make sure that we build on that momentum and don't forget about the progress that has already been made.
Thanks, Ryan. Marianne?
So I'll riff on that a little bit. In some ways, at Cradle to Career, we're very lucky in that the statute that established our office is very clear that the whole point of Cradle to Career existing is to link data and to bring it together and to make it useful for decision makers. That's what we're held accountable for, and that's kind of why we exist. So we have that statute to lean on. But I think there's also other examples. I would point especially to the Evidence-Based Policymaking Act that was passed at the federal level some years ago, and some of the guidance that OMB has put out to federal departments and agencies about how data sharing should be made the default. Default to yes, default to being able to share the data, especially for learning purposes. And so in some cases, there may also be ways in which some of the federal guidance and the Evidence-Based Policymaking Act might be relevant across cases as well. The other, you asked about myths. I think the other one that I would point to is this idea that if you build it, they will come and they'll love it and use it. I remember early on in my career, one of my colleagues pointed out that a very, very large international organization, the median number of times their PDF reports were downloaded was 0. And these are, reports that people very thoughtfully, and diligently labored over. And so I think that that's kind of what I think about every morning as I wake up, is how can we ensure that all the hard work we're doing to be able to bring these data together and link it is actually going to reach people in a way that they can use it, where they find it useful. What kinds of dashboards, if you think about what you use, whether it's checking what the weather is going to be, or maybe looking at relevant dashboards for the sport you most like to watch and follow, why is it that you go to those websites again and again? What can we learn from that to make sure that what we're building is actually useful? And so that goes back to the whole point of make sure you're talking to people, listening to them, watching them, use whatever you're building before it's actually released. So that's my thought on the myth as well.
It's fantastic. Thank you both for the work you're doing and for taking the time to come and share. Join me at home with thanking them. And John, I'll pass it back over to you.
Excellent. Thank you both. Thank you all 3 of you. And I don't know about you, definitely learned something during that segment. And I think one of the things is balancing openness with privacy and security is absolutely complex, but it's a crucial part of our work here at CalHHS. So switching to, we've gone through a lot, and I always try with these data expos we do with our team, and thanks goes to the data subcommittee for just giving such rich content and bringing so many great esteemed experts here today, is looking ahead. And when I look ahead, I didn't have a lot of time to do the closing, so I just wanted to just pull up some technical support and phone a friend, and I'm just here chatting with my chat GPT and saying, I have a data expo conference and just wanted to know if it could help me write my closing script. I don't know if any of you have messed around with ChatGPT, generative, pre-training, transformer, or AI. So we have a Slido poll. It's already out there. You guys are already going. 25 of you are out there. Let's see if we can get more in the Slido poll. What are your thoughts on AI? It did a really good job on the script. I won't read it all because it was quite a long script. Maybe I should have been more specific with that chat and say, give me a 1-minute closing. But I see a lot of nervousness. I don't even see the 4th one up there. But there are about 32% of the folks out there that are using it.
There's some excitement.
Yeah, interest. And I guess maybe look in the chat and see if there's something that maybe over the next few months, if CDII and our data subcommittee would put out, a webinar or thought, if there's interest, the more we talk about it, maybe the more we know, and we can get over those fears, just like data sharing and other things.
That's right. We'll be having lots more conversations about this.
Yeah. All right. Well, thanks for participating with that. So definitely, as we draw to the end of our 9th Data Expo, I wanted to definitely give a shout out to our keynote speaker, Dr. Ghaly. We missed you, but your insights and expertise and time have been invaluable to us, and we look forward to seeing you at next year's event, and all of you.
Absolutely, and we know there was a lot of information shared today, and you might want to revisit some of these discussions. And we've got good news. Our dedicated production team, thank you very much, will be emailing a link to the recording of today's live broadcast within the next 2 or 3 business days. You'll be able to watch the expo on demand at your own pace and share it with your colleagues who couldn't make it today. Or, for instance, myself, I know I'll be making my kids watch it this weekend.
Oh, nice.
So they know what I do.
Yeah. Get that next generation of data.
Exactly.
All right.
Right? I mean, they probably use AI more than I do right now.
Be careful.
Yeah, exactly. Along with posting the video, you're also going to receive all the resource materials that have been used during the event, so you can delve deeper into the topics we've discussed and maybe spark some new ideas or solutions.
So before we sign off, we'd like to draw your attention to the chat box one last time. Our team's been sharing resources throughout the event. If you haven't done so already, you can take a moment to check out those additional materials. Hopefully they will enrich your understanding of the discussions we had today. Also, we would really appreciate if you could take a few minutes of your time to answer your exit poll. When you exit out of Zoom, it'll probably pop up a poll, or you will be getting one in your email. And it's really important feedback that our committee looks at when we're trying to plan future events. So with that, a big thank you to our team here. And there's a few folks in the back that if they came up here, I'd be so happy. Barbara, Jennifer, any other folks? They're not coming up here. I don't see them yet. Reeling them up here from our team, our entire CDI team. Barbara, feel free to yell out other folks that you'd like to thank then. Everybody. Thanks so much for joining us, everyone. We will see you and hope to see you at our 10th anniversary edition of the Data Expo next year. Go have a great day and be good to everyone. Thank you very much. All right, man.